present. The quorum was present before I got here. I was just expected like Utke would have like, yeah, we are the quorum. Well, there are members in and out all day. We have multiple hearings going on and back and forth. And so just as we begin today, we're going to mark up our omnibus policy bill, right? We have all the work that we had done and the great bill. It's a great bill. And then we also have then yesterday Senate file that will do a markup on 4222. And that's Senator Abeler's bill. We had Senator Wickland. We moved it. That's going to be our moving place with all of the work that we're doing in integrity, right? And that's just, so it's going to be, right? Is that correct? Did I get that right? And so let's do that. And then there's I have a whole list of amendments. There's testifiers today too. So we want to keep that, get to your point. I'm going to put you on a 2-minute clock and then we're going to move on. But let's start if members are okay. Senate File 476. There's a A2 delete all, delete everything amendment. So if I want to do that, I want to move adoption of the A2 delete everything amendment to put the omnibus in the proper shape. And yeah, I already said that. I love it. He just reminded me of quorum as president. I was just like, we got all members say aye. Aye. Opposed, same sign. That is there. Next, we're going to hear public testimony on the omnibus bill. So testifiers Matthew Bergeron and Eric Larson, will you work your way up here? And if you would, you're here testifying the specific, if you want to testify in specific amendments, because we have a list of those, can you wait until the amendment is moved and then we'll bring you back up to speak? Does that work? Or so Eric stopped, Dr. Larson stopped. For the record, Matthew Bergeron and Dr. Eric Larson. For the record, Mr. Bergeron, go ahead and tell us who you are.
Thank you, Mr. Chair, committee members. My name is Matthew Bergeron. I'm a healthcare and government relations attorney with the law firm of Clark and Hoffman here, representing the Residential Providers Association of Minnesota. Just wanted to provide a couple of quick comments for the committee. We have had over the last couple of weeks concerns with some of the language in the bill regarding restrictions on congregate care settings. We've been working on the amendment before you. We're really happy that those conversations are continuing to progress. There are a number of pieces in the bill regarding new regulations for assisted living facilities, requirements regarding AEDs, and some of the documentation requirements for like response times. We're having conversations with advocates on that as it relates to the impacts on small settings for 5-bed assisted living facilities versus larger settings, and kind of how those things might be scalable or implementable for small settings, particularly folks serving individuals on disability waivers versus older Minnesotans or folks on the elderly waiver. But we do want to note there's some really fantastic stuff as well. Some of the language that would create some additional flexibility for small assisted living facilities to relocate. We think that's a big part of the solution to some of the concentration, is that as other opportunities become available, that those settings are able to move. And lastly, the continuity of care changes in Article 1 are a really important part as we've been working through issues in having to make sure that folks are safe, even as providers come under instances where there's concerns about payments or program integrity. Making sure that the resident is centered in those conversations is super important. So thank you, Mr. Chair and members.
Thank you, Mr. Bergeron. You're going to be here all day and all evening, right, with us? So
at your beck and call, sir.
Dr. Larson. And Sumika, you want, my old intern is here. This is great. You want to start making your way up to the desk. Dr. Larson, welcome back.
Thank you, Mr. Chair. It's a pleasure to be able to speak to you. I took a little stutter step because I wasn't sure if you meant a new amendment being introduced today, but I'm speaking on the amendments that are on the bill already. I'm Dr. Eric Larson. I'm the chair of the Autism Treatment Association of Minnesota. We fully support the efforts to defeat fraud in Minnesota's EIDBI program, yet the current efforts are being rushed into statute, and some of the ADSA policy provisions may impede the ability of our providers to deliver sound and ethical services to the needy children of Minnesota if drafted wrongly. So of my 3 points, one, we applaud the improved definition of clinical supervision to fully identify the auditable billing codes for this service. This is an important and valuable service that should be required to be delivered by the QSP. But two, we also applaud the Senate amendment for the minimum requirement for observation and direction to be able to be delivered by both QSPs and level 1 providers. This is a key provision because the current workforce shortage prevents agencies from hiring sufficient QSPs to do the meaningful work that it entails. Fortunately, the original drafters of the IDBI statute in 2013 recognized the significant workforce shortage and therefore incorporated the generally accepted national standard for the tiered model of ABA as published by the Behavior Analyst Certification Board and the Council of Autism Service Providers. The tiered model was explicitly designed to address the workforce shortage while requiring that the QSP still take professional responsibility for appropriately delegating services as they are licensed to do by the Minnesota Board of Psychology. Hence, the minimum observation and direction requirement still allows providers to further extend necessary supervision through the level 1 and the level 2 providers. If that workforce shortage were not taken into account, the resulting loss of access to EIDBI services would have devastating health effects to children with autism. The legislature should consider the massive financial impact on local families and schools if we providers were to be limited by the requirements. Finally, 3, we also express serious concerns over the 90-day financial solvency and surety bond language, which imposes an additional cost on the providers who have already suffered one payment cycle being withheld by DHS and also now face high fees to be paid to DHS for the revalidation and for the provisional licenses this year. We fear that this financial requirement will very likely lead to some small nonprofit providers being forced to sell out to large for-profit and equity-based companies. In order to prevent the resulting loss of access, we suggest including an exception for existing preferred providers, lower amounts for compliance, and a 2-year delay to give time for providers to prepare financially and recruit the bonds. When ethical providers have the financial ability to deliver effective services, the families will be less susceptible to being recruited by fraudulent providers. Thank you.
Mr. Chairman.
Senator Abeler.
So, Dr. Larson, do you know where that on the sheet that level 1 and the QSP language is? Mr. Monahan, do you know what page that is?
I can.
I thought we took that piece out. Senator.
No, I think it's in that the Senate has, you can have a choice of 2 providers.
Correct.
So I just want to make sure that we understand that we have to keep that. The other body only has QSP.
Correct.
Which is problematic. And that the intention of our work in that little private secret room that we worked in last year was to have that. And then the legal counsel from the crack council at DHS
It was not private
decided
secret,
to not follow our intent and then do what they thought the word said. So but it's important that stays. And I think the 90-day thing is in the House.
Other body.
And just so you know what that means is that is close to $600 million of requirement on these little, so it's really problematic. So thank you.
Thank you, and thank you for that clarification. And yeah, Dr. Larson, just watch that as we get hopefully we go into a conference committee, which is the way this committee's always done conference committees has been wide open to the public, so we can do that. So, all good? Anybody else for Dr. Larson? Senator Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, Dr. Larson, so you're associated with the autism industry?
Yes,
Okay.
I provide services to young families with autism.
Yeah, and I have a nephew who was on the spectrum too, so I definitely want to help autistic children. I think all of us do. But last I read, there was only 6 new autism centers that got licensed. Has that changed it at all?
Well, the application for all of the centers is due by the end of May, and it's an extremely laborious process that takes about all day to fill out the application, and we just learned this week that the Save for Later button on the website doesn't work. So if you spent several hours and then wanted to save for later, you lose all your work.
It all just disappears.
So so people are applying. There's a lot of documents to upload.
Senator Abeler,
Mr.
thank
Chair,
you.
is that the min save feature that we have? Everything with min doesn't work, it seems like. Mr. Chair, the language about the 2 providers is 50.30 for a
Thank you.
couple of lines.
Senator
You just have
Gruenhagen,
to be sure you hold that.
we got it. I love it. Senator Gruenhagen.
Oh.
Don't
yeah,
save it later, Glenn.
Yeah, right. Thank you, Mr. Chair. Yeah, so from your perspective, you've been involved with this, why do you think we had so much fraud? I think it went, over a number of years, went from 15 or 20 centers up to over 500. I mean, why do you think that happened without some type of red flag going up?
Doctor?
Senator, and Chair, the program itself was passed in 2013, and it took 5 years to build out the regulations to actually enable the program to be used. So it really wasn't started until 2018. Nobody was doing it then. And providers were using other funding sources and eagerly embraced this program because it's so much better designed for autism. So it's still, because of the workforce shortage, then it gradually built up over that past 5-year time. And if you had asked me 5 years ago, is there fraud in this program, I would say, no, it's way too highly regulated. It shocked me to hear that there was fraud in our program. Even when we were hearing about feeding our future, I was thinking, well, it won't be in this program because it's too highly regulated. So I'm still curious, who's counterfeiting what and how does it slip through the system? Because I can't even imagine how I could have pulled it off.
Thank you, Dr. Larson. Thanks, Glenn. Thank you, Dr. Larson. Sumaka Tarakanambi. Did you get your PhD yet?
No, not.
Close. Welcome back, man. Good to see you. Are you here on behalf of the council?
Yes.
All right, thank you. Sumaka.
Yes, I can get started. Chair Hoffman and members of the committee, thank you so much for the opportunity to testify today. My name is Sumaka Tarakanambi, and I'm a public policy consultant with the Minnesota Council on Disability. I'm here today to speak on behalf of MCD in support of SF 476, the Human Services Policy Omnibus, particularly its focus on continuity of care during fraud investigations. In addition to my professional capacity, I'm also here as a person with a disability who relies on caddy waiver services to live independently in the community. Therefore, I know firsthand how important these services are and how any disruptions to services can cause significant harm to people with disabilities. MCD serves as a liaison between Minnesotans with disabilities and the legislature. In recent months, we have heard consistently from community members who've experienced significant service disruptions as a result of the state's response to fraud. While we support strong fraud prevention, many of these actions have been implemented without sufficient safeguards to ensure continuity of care for individuals who rely on these services to live independently. The result has been uncertainty instability, and in some cases, immediate risk to health and housing. These concerns were reflected in our legislative priority survey and legislative forum, where individuals and families shared the real-world consequences of service interruptions. Given this urgency, we strongly appreciate that Article 1 is dedicated to continuity of care protections. The bill establishes a continuity of care team within the Department of Human Services that is responsible for identifying individuals at risk of service disruption due to payment withholds, providing timely notification to impacted individuals, lead agencies, ombudsman offices, and case managers, coordinating contingency plans to maintain services. Importantly, the bill prohibits payment withholds until continuity protections are in place and includes a good cause exception when alternate providers are not available. These provisions represent a meaningful step toward person-centered fraud prevention, and we urge the committee to retain this language as the bill moves forward. We also support several additional provisions that improve access to services and strengthen protections for people with disabilities, including increased flexibility for unit-based services such as in-home support with training, a monthly versus a daily limit, greater flexibility for shared services within CFSS budget and agency models, stronger maltreatment reporting and clarified lead agency responsibilities, the housing stabilization services redesign, prohibiting facilities from requiring a guardian or conservator as a condition of admission. And finally, policies addressing the concentration of group homes and increased transparency in corporate ownership of nursing homes. While we largely support the bill, we do have one concern. The licensing moratorium on community residential services and adult foster care may further limit already constrained service options. We are encouraged by the inclusion of exceptions and urge the committee to ensure that any exception process is clear, timely, and accessible. Overall, we appreciate the committee's work to prioritize continuity of care, choice, and safety for Minnesotans with disabilities, and we look forward to continued collaboration. Thank you so much for your time, and I'm happy to answer any questions.
Sumika, thank you. Senator Abeler.
Thank you, Sumika. I appreciate that. If you could, and just so you know, I don't know, you have these, this kind of the qualitative commentary, but if you could give us give me the sections or us the sections that you really want to make sure we keep, because this is going to go into a, page 4 or, line 19 kind of stuff. So just if you could, not now, but just get those to us. You have plenty of time. There's more than a week. So thank you.
Yes, I can do that for sure.
So Sumika, just so you know, Senator Abeler, remember the work we did on Connect 700, the fix? He's the one who fixed it. That was so. Thank you, Sumika. Good to see you.
Yeah, good to see you too. Thank you.
Before we go to member amendments, there's a few amendments that we need to pass. I want to move the A23. Members, this is the technical revisions that Mr. Monahan did and the other nonpartisan staff to get our 476 in order. So Mr. Monahan can answer any questions if there are any. Senator Rasmussen.
Thank you, Mr. Chair. I was wondering if Mr. Monahan could walk through the amendment while we take a look at it.
This would be the A23, which is the technical revisions. It's being passed out. You will see all those listed on there. So Senator Rasmussen has asked Mr. Monahan to run through the technical revisions. Mr. Monahan.
Mr. Chair, members, beginning on page 1, line 3 through line 37 is a reviser's instruction related to the recodification in the first 3 sections of Article 2, where we're recodifying section 245A.03 subdivision 7. That is the existing foster care moratorium language that it has been rewritten at the beginning of Article 2. The instructions between line 38 and 41 are just changing the article headers. Line 42 is a request from the Department of Administration related to certain duties at direct care and treatment, that the bill include the word delegee instead of designee. At the top of page two is another change to the article header. Lines 3 through 14 are all requests from the Department of Health related to clearing up an ambiguity between the use of the mere word emergency, which in their world means a natural disaster or similar, and making sure that each instance of the new language include the word medical to distinguish it from other types of emergencies. This is mostly related to the, I believe what Senator Abeler refers to as the fall language, and having a response to other medical emergencies in assisted living facilities. And then finally, there's just a technical amendment at the bottom, amending the title of the bill.
Senator Rasmussen. Senator Abeler.
Well, thanks, and I just on this fall language, probably a good shorthand for it. There's still discussions going. There will be another amendment coming, I suppose, on the floor, reflecting the agreements that they're, I think, very collegially working on. And this is the Department of Health PA, I think, and what's here. So, thanks.
Thank
I
you.
don't think it's controversial.
And members, as different the amendments that people are offering, they're not, most of them aren't in your packet. They'll be handed out as folks do that. So all those in favor of the A23 signify by saying aye. Aye, opposed, same sign. Thank you. So let's move then the A22 amendment. I move the A22 amendment. That removes provisions. Remember our history here is if something gets flagged as a fiscal cost, we either get it pulled out in finance or we take care of it here, where we're trying to take care of it all here. So the A22 is the amendment and removes those provisions that we flagged as fiscal costs, and they're more appropriate for a finance bill. So if you want, Mr. Raymond can talk us through those provisions that were being removed if people want. So Mr. Raymond.
Mr. Chair, members, I'll walk through each line of the amendment. So I'll start with first lines 1.3 and 1.5. So these relate to Senate File 3898, which relates to home and community-based services regulation modification. So it deletes section 13 and 38, which the Department of Human Services identified as having a cost. Moving next to line 1.4. So this relates to Senate File, it's a portion of Senate File 3657 relating to billing limit changes for individualized home supports. So the lines that are being removed have a cost to medical assistance and are removed in the amendment. So next I'll move to line 1.6. So this is a portion of Senate File, the first engrossment of Senate File 4279 relating to congregate care changes. So this removes one section of that, and I believe there's another amendment posted, the A18 amendment, that removes the remainder of the bill. So the Department of Health identified multiple costs related to that language and is being removed as such. Moving next to line 1.7, so these changes remove the entirety of Senate File 2972 relating to the regulation and notice requirements for, related to the purchase of nonprofit nursing homes and assisted living facilities by for-profit entities. So both the Department of Health and the Department of Human Services identified multiple costs related to that bill, so the entirety of the bill is removed, and that concludes my remarks.
Senator Rasmussen.
Thank you, Mr. Chair. And for the for the bill on proximity that I know we debated, so it's my understanding that this amendment is pulling out part of that, or all of it, or?
Mr. Chair and members, there's another amendment where that piece is being pulled out. That should be the A18. That should not be listed in this amendment unless, I'm thinking proximity on what should have been a 245D provision, but was 144G provisions from 2018. Are you talking about that proximity or the proximity of what Mr. Raymond was just alluding to?
I think Mr. Monahan.
All right, Mr. Monahan.
Thank you.
Mr. Chair, Senator Rasmussen, line 6 of the amendment removes the portion of that bill to which you were referring that was related to the Vulnerable Adults Act and the reporting requirements. So it was actually a drafting error on my part. This should have been in the other amendment, but rather than redraft them, we just left it there.
See where my brain was? I was like, sorry, I was on the wrong amendment. I thought you were skipping on me, man. It was good. Senator
I
Abeler.
have more questions,
So,
Mr. Chair.
Mr. Chair, I'm not going
you-
to ask to go through.
Sorry, I missed Senator Rasmussen. That he was done. He has a
Oh.
follow-up. Sorry about that.
Thank-
Senator
Totally
Rasmussen.
fine to wait. Thank you.
Thank you, Mr. Chair. Question, if Mr. Raymond, could you explain again what we're doing on line 1.4 of the amendment?
Mr. Chair, Senator Rasmussen, so on line 4, so this is a portion of the Senate File 3657. So this modifies individualized home supports billing limit changes. I don't have the language in front of me, but my understanding is there was an exception that was made in certain circumstances in that language. So that change has a rather substantial cost to medical assistance. So it specifically removes the exception language.
Senator Rasmussen, a follow-up, or you're good? All right, Senator Abeler.
Yeah, and we can haggle later with the department about what should cost and what shouldn't cost. It's
No,
just
let's get them up
interesting.
right now.
Nah, it's fine. No, I don't want to waste the time. But like even that like reporting stuff on page 25, section 13, I don't know why if you make a provider maintain records that the department has to pay for that, but it's fine. Well, I just think that would be like a good thing. And then they're going to find fraud and actually save money. But I'm done, Mr. Chair. We'll take these up on the finance bill.
I have that on record. Senator Abeler said he's done for the day, so there we go.
I'm done for this amendment.
Oh, this amendment, okay.
Yeah.
All those in favor of the A22 amendment, say aye. Aye. Opposed, same sign. All right. So there's an A18 amendment, and Mr. Raymond alluded, you asked the question, Senator, so I guess if you want, we can, but otherwise the A18 addresses what you just brought up. So if any questions on the A18? It's being handed out. So, yeah, just what it does is it removes, we can have Mr. Monahan describe that, Glenn, but it removes some sections related to Senate File 4279, a work in progress. So if you look, yeah. Well, this is nothing. 10 years ago, there was a pile of there was a pile of amendments, Senator Zadim, and we ended up getting through them. It's just welcome to human services, right? Be flexible, and stuff is a moving figure.
Mr. Chair, I do have one question on the A18.
Senator Rasmussen.
Thank you, Mr. Chair, and either for you or for nonpartisan, if the A18 is adopted, what remains of Senate File 4279 in the underlying bill?
Mr. Monahan.
Mr. Chair, Senator Rasmussen, nothing.
And also, that it gets addressed in
This is
the
a compromise?
A21. Correct. Yes, that is a compromise.
Mr. Chair, can compromise between?
So you had members of the community, there's a compromise between the municipalities and providers and the advocacy groups, so they all did their work to get this point. If there's still working to be done, this committee has got a history of saying people get into a room and, and do it out. But I think this compromise is between the municipalities, the providers, and the advocacy groups, and folks were working on this. So I'm happy the fact that people were working on this and that I'm not happy with one of the outcomes on it, but then again, that's part of the compromise. Folks did their work, and we got to applaud them for that. So,
This was your bill?
yes,
Mr. Chair,
Mr. Senator.
the city of Coon Rapids that you just represent a tiny sliver of likes the compromise.
They do.
Yeah. So, I mean, yeah, Matt called up and said that they've been working.
Matt's okay
and-
with it, really?
Yeah. So, I mean,
What about Glencoe? Did you get a call from Glencoe?
they're happy. I don't know, maybe, I don't know.
I don't know. Did you get a call, Glenn, from Glencoe? Are they happy?
I doubt if they're happy to tell you the truth.
All those in favor of the A18 amendment say aye. Aye. Opposed, same sign. Thank you. All right, that's putting us, we're getting there. And everybody, they were working, we have reached a place of agreement between those stakeholders like we just talked about. That compromise language is represented in the A21, which has been identified. There is a fiscal cost. For that reason, I will not be, some of that stuff in the A20 will not be brought forward because of the fact somebody flagged it as a fiscal cost. My intention, though, is to include the language of the A23, the A21. It says A23 here. Did you say A23? A21. When we put together our budget bill. So that we are going to still work on that when we put our budget bill. Does that make sense, senators? Senators?
Mr.
Udke's got a thumbs up. So with that,
Were you going to review the elements of the compromises so we can know, there's no distance in there, I understand, but there's.
Correct.
There's quality of citing a resident.
Yeah, there was a compromise getting the cities to get, so Mr. Monahan, if you could, if you have that up in front of you, that would be great. If not, Jim, I
Just
can walk
like
us
a
through it.
1 minute.
1 minute little piece, absolutely. If not, I'll get Bergeron up here and he can.
Mr. Chair, Senator Abeler, and members, my understanding of the compromise is, just to get to the core of it, to remove the 650-foot proximity limitation and instead leverage a current policy used by DHS with respect to authorizing services or licensing HCBS providers who have service settings that have adjoining or adjacent properties, and expanding that current regime to apply to all small assisted living facilities and all group homes, rather than the current limit, which is the same provider can't have two settings adjacent to one another.
Senator
that's helpful.
Abeler, then Senator
That's good,
Gruenhagen.
thanks.
They're good? Senator
I'm gonna vote for Coon
Gruenhagen?
Rapids today.
Yep. Senator Gruenhagen?
Oh, thank you, Mr. Chair. Yeah, so does this policy apply statewide?
Senator Gruenhagen, the answer is yes. But we got the issue, you remember you brought up was that the distance piece, and they got rid of that. And I think I won the argument from this committee 10 years ago when I suggested that Department of Human Services should have more say called 245D. Do you remember this, Senator?
Yeah.
And so in this case, the co-location of certain home and community-based residential settings, it now gives a clear, we know who's in charge of making those determinations. And I guess I'm happy with that, but we still have a problem.
Yeah, the thing is that I know we're going to handle this later, but the thing is, I have reservations about one size fits all across the state. I mean, there's small communities that might need a little flexibility on this, so I think maybe for the metro area or something like that,
remember?
And start with that
Yeah.
rather than go one size fits all. That's just my input.
No, that's good, and maybe we can explain it, Senator Abeler could explain it to you, I can explain it to you too. On the co-location of certain home and communities residential settings, this should not have any bearing on the fact of what you were talking about in New Auburn and that area, so. Senator Abeler.
So it may actually increase the quality and then therefore reduce fraud, so another anti-fraud.
To that point, I think the compromise on here gets that point, because now the point place, because we had a problem with who's in charge of this. Is it MDH? Is it DHS? Is it the lead agency? And now guess what, Glenn? It's DHS.
Okay.
So I think to me, that's a good piece. Does that make sense?
Yep.
All right, so I don't think I need to do anything. We already moved the A18. We're not going to move the A21. And that's it, correct? So now Senator Abeler, I think you want to do your A5, or am I moving on? You got Brian Zerbes and Tammy Roth coming up for your A5. I think it's the A5, Jim.
Mr. Chair, I'll move the A5, and maybe Mr. Zerbes can talk about it while it's being passed out.
Senator Abeler's moved the A5. You want us to vote on that first, Senator Abeler, or you want to just have the discussion first? I love it. Brian Zerbes, welcome.
Thank you, Mr. Chair and committee members. My name is Brian Zerbes. I'm the Executive Director of March, a statewide trade association for substance disorder programs and professionals. I'm going to be speaking on the withdrawal management component of the amendment. Withdrawal management services are a medical version of detox. These programs provide emergency access for people that are intoxicated or in withdrawal. The language would exempt authorizations from the first 5 days of treatment for when someone gets admitted to one of these, a withdrawal management program. And the language would enhance a program's ability to be paid for the services rendered. That concludes my testimony. Thank you.
Wow. Senator Rasmussen.
Thank you, Mr. Chair. Question on the amendment is, have you received any feedback from the Department of Human Services on this amendment? Do they have any concerns?
Thank you,
Mr. Chair,
Mr.
Senator
Zerbes.
Rasmussen, we did work with the department over the November, December, and January. The 5-day window that was identified was actually technical assistance that they advised, which we incorporated.
Mr. Chair.
Senator Rasmussen.
Thank you, Mr. Chair. And on the A5, so you're saying the excluding weekends and holidays has been reviewed by DHS. What about the withdrawal management services? Do they have any feedback on that language?
Mr. Zerbes.
Mr. Chair, Senator Rasmussen, both provisions in the amendment were included in our package of policy proposals that we reviewed with the department a few months ago. I do not recall them providing technical assistance on the discharge summary timeline or raising concerns a couple months ago. But on the withdrawal management component, they did want to have a day window identified. So we settled on the 5-day exclusion window.
Senator Rasmussen, follow up, you good?
Thank you, Mr. Chair. I just wonder if we could get anyone from DHS. Do they have any concerns with this amendment, or? And the reason I'm asking, Mr. Chair, is, when we're talking about utilization reviews, again, we've unfortunately had issues within the SUD industry on making sure that their clients are getting the appropriate services that the state's paying for. And so I just want to make sure that with this amendment that we're not creating any potential issues there.
No, that's a great question. Ms. Grom, welcome.
Mr. Chair, Christy Grom with the Department of Human Services, Senator Rasmussen. I know our program areas have worked with March and Mr. Zerbes on this language. I'm not familiar with the specifics. I know we've provided the technical assistance described here. I do want to go back to our licensing team just to relook at that language in statute and 245G to make sure that we're okay with it. But we have a great relationship with the providers, and I think we share many of the same goals, and we'll be sure to work this out for the committee and keep you apprised of our status.
You good? Senator Rasmussen's good with that. Thank you. We also have Tammy Roth, Lakes Counseling Center. She's on Zoom.
Hello, can you hear me okay?
I can hear you.
Okay, wonderful. My name is Tammy Roth. I've worked in the addiction field for almost 14 years, and I've been a licensed alcohol and drug counselor for the last 5.5. I'm here speaking on the A5 amendment on the discharge summary piece. Addiction counseling staff are frequently stretched thin due to workforce shortages, excessive documentation requirements, and a desire to provide high-quality client care. When a program determines that a client is eligible for discharge, the primary counselor currently has 5 calendar days to complete a summary of termination of services, also known as a discharge summary. If their schedule for the week is full between group and individual sessions, care coordination with others involved in the client's treatment, and paperwork and billing timelines, it can be very difficult to find time to add this task. As a result, counselors often work beyond their scheduled hours or outside of facility operating hours to maintain agency compliance. This proposal is simple: to change the timeline in Statute 245G.06, subdivision 4A from 5 days to 5 business days, so that weekends and holidays can be excluded from the time requirements for completing discharge summaries. I respectfully request your support for these changes to ease the pressure on addiction counseling staff. Thank you for your time.
Thank you, Ms. Roth. Senator Abeler, thumbs up. Senator Abeler has the A5 amendment. We heard from everybody. Questions asked, questions answered. All those in favor of the A5 amendment say aye. Aye, opposed, same sign. Thank you. A5 is now being put in the markup. A6 amendment, Senator Abeler, is that, you want to do that, or?
I have the A4 I can talk about if you want.
You want to do the A4?
Since I have that in front of me, I can talk about that.
That's fine, yeah.
MAEPD. Kind of a sequential thing, Mr. Chair.
Is your mic on?
Is it working?
Yeah, oh, it is.
Can you hear me now?
It was weird, I couldn't hear it.
Must be the Verizon commercial. We should have sponsors for our hearings, and then they could pay money to have their name mentioned a few times, and then we could actually put that money into the budget and help people to be kept in their homes longer. And how's that?
I love it, because after last week when I brought up the corn, do you put corn in your hot dish, and everybody should have been a great.
Well, there are yes corn people, and there are absolutely not corn people.
That's correct.
Maybe we
So
should have testifiers
had some kind of pale on
if they're
that.
pro or anti-corn. So, Mr. Chair, I move A4.
A4 is in front of folks.
This is from Mr. Wudlick, and I don't see him here today.
You got anybody here?
But anyway, this is it's a new bill, and so maybe the department wants to come up and just help us. This is a way to not kick people out the back door in MAEPD, just due to some things that happen. If they don't, on line 2.9, it says for good cause, they don't get renewed. They have a little time not to get kicked out. And it's that idea. And they have to be given due notice to do the renewal. So that's the bill, and Rob just brought this to me.
No, I love that. Who brought it to you?
Rob Wudlick.
Oh, yeah, no, this is good. If there's a fiscal, I think we've reached out to the department regarding if there's a fiscal, so we're not hearing, haven't heard anything yet, so.
Take it off.
Yeah. This will be the prime example of going to finance.
Well, we're not going to finance, but we're going to go to the floor.
We'll go to the floor, we'll take it
Take
off if we
anything
need to,
out.
if it does.
Yeah.
Senator Rasmussen.
We'll put it in another bill.
Yep, I hear you.
Thank you, Mr. Chair. And Senator Abeler, would you mind just kind of walking through the amendment I just want to make sure I understand what it does.
Well, Mr. Chair, I'm just looking, I don't know who SC is, but I know who LM is. So maybe Mr. Monahan could guide us through the aspects of it, so.
Mr. Monahan.
Mr. Chair, Senator Rasmussen, the language in the bill is related to, as I understand it, concerns from those employed persons with disabilities who qualify for MA, who need to have their income eligibility redetermined every 6 months. My understanding is that often their income is quite variable, and sometimes meeting the required submission deadlines to be redetermined are difficult for them to achieve or comply with. So the language here gives greater flexibility or sort of a grace period for them to complete their eligibility redetermination based on their income. And it requires the department to send them certain paperwork in a timely fashion so that they're on notice of their requirement to redetermine their eligibility.
Senator Rasmussen.
Thank you, Mr. Chair, and thank you, Mr. Monahan, for the description. Is this language from another bill, Senator Abeler or
Yeah,
Mr. Monahan? I'm just wondering.
it's a bill that just got
if we saw
dropped
this.
lately.
Okay. Thank you, Mr. Chair. Thank you, Senator Abeler. I mean, my thinking is, and I understand what the policy is doing now, which I appreciate. I understand the rationale for why you'd want some more flexibility, but my just kind of basic thinking would be if this is going to allow more people to access a benefit, it's going to have a cost. And so that would just be my concern, is that it's, could be quite likely to have a cost, maybe not. And maybe there's some information that I'm missing. But that would just be my concern, is, having a fiscal item on the policy bill.
Yeah, I think with that, if we find out, we did put a request in for if there is a cost, Senator Rasmussen.
Yeah.
And if there is, then I think we just pull it off the floor. That's what we've done in the past, either finance or floor. But this one, we would go policy. We don't know. There's some assumptions it might, but this is MAEPD. I'm going half and half on it, Senator Abeler.
So and so just so you know, I mean, I think that's a pretty well-known program, but the people on MAEPD aren't sitting around just getting rich. They're trying to keep working, and we even have a trouble if they make too much. They have to stop making money to stay on it.
Yep, I got it.
And like they're capped, and we've tried since I've been here. I remember Representative Paymar back in the day was working on this. And once they get in, you want to let them try to stay so they can be rewarded for working. And I think, if it costs anything, I would have to, we don't do dynamic scoring except when it comes to fraud, Mr. Chair, and the governor's budget. But maybe that's not actually even funny. It's like amazing. But, but preserving the services for individuals and opportunity to stay on this program will keep them more whole and keep them out of some other bad place that they might land in, and help them not lose their jobs and all that. So I hope that as we talk to the department, they can come chat with me, and I'm happy to work with them to
Absolutely.
keep the cost out of it.
I think we put this on, and this is what gets me, is the people that came to see us, MAEPD, and their services were cut, and they are people, medical assistants, employed people with disabilities. I get this. I like this. Senator Zainab Mohammed, ladies and gentlemen.
Thank you, Mr. Chair.
You're welcome.
For paragraph B, second page of the amendment,
Yeah.
the second line, it says, for a person enrolled in medical assistance under section 245B, 256B, who due to a good cause is unable to respond within the required time frame. What is good cause defined as?
Senator Abeler. He's not. The good cause clause. Do you know, Mr. Monahan? Can you?
Sure, exactly. It's a cause that's good. Like, it's a good reason. Like, tell me why you didn't do your report. The dog ate it. That's not a good cause, Mr. Chair. But like, these are individuals. Maybe they couldn't get a PCA, Mr. Chair.
Good cause.
Mr. Chair, maybe they were, maybe their provider was on a payment hold, and they didn't have the services they needed to actually get out of bed, or they were in the hospital for some medical condition. And I think that the department I think they will be very careful at the department not to just, it just didn't feel like it is not a good cause. That's what I think, so just, that's the best I know. And there may be a definition that Mr. Monahan.
There is a legal definition in statute on it. Mr. Monahan, do you want to, is there a definition anywhere we can use that refers to good cause?
Mr. Chair, I would have to look into that. There are definitions of good cause, but not one that I'm aware of that refers to this particular set of circumstances.
Thank you. Senator Zainab?
Mr. Chair, I think we should define that before putting it into law. I don't know if that's right now, but we should figure out what a good definition for that is.
Mr. Chair,
Senator Abeler?
I'll work on that one too. Thank you.
I think that, and Rob, I know Rob said this amendment should only help the people in the program, so it stays, it's, clarify that up. It should, I know that. Senator McQuaid.
Thank you, Mr. Chair. I support the amendment, Senator Abeler, and the reason I'm asking this question is from experience, not from opposition. But I remember I tried to change the stricken language in 23-24, Mr. Chair, to the eligibility determination happened every year, and found out later that eligibility determination is not in statute because of Minnesota lawmakers, it's because of the federal law. And so I just want to make sure, are we still within the confines of the law with this change?
And that same question, thank you, Senator McQuaid, that same question will pop up if this is within the guidelines. So you might have to have some part of that stricken out or not, depending upon that, the answer to that question. I hear you.
And Mr. Chair, I'm not sure if Senator McQuaid was talking about this, but Mr. Wedlick has popped up his head. And it says this amendment should only help the people in the program. It's not to expand inclusion. It just keeps them from getting kicked out.
Yep.
That's all, just so people know. And we'll sit down with the department. And I know that the department, we want to make sure that these individuals can.
Well, when Elise Bailey's head is shaking, yes, that means she will be more than happy to sit down and help us. Senator Rasmussen, we're good?
Mr. Chair, I just think this was going to have a cost, so I think there's going to be a cost associated with it. So I would.
You got the over or the under on that?
I think there'll be a cost on this, and I would rather have it be discussed in a finance bill. But I understand the intent of what's trying to happen here.
All right, okay, thank you. There is, the discretionary of the lead agency, right? Isn't that good cause? Did you want to, there is or not? All those, is it the A4 amendment, folks? Is that right? All those in favor of the A4 amendment say aye. Aye. Opposed, same sign. It passes. So, Senator Wickland is not, Jim, do you have another one?
I have the A6.
That's the one I'm looking at, the A6. You want to pass
Chair,
that out?
This is the Senator Kupek in lieu of being here. I'm being him today. I can predict it's going to be a nice weekend. Sunday should be a particularly good day to get out with your family and go to the parks. I think mid-60s, chance of SPF need. So that's just from him. So there you go. This is a technical, I'll move the A6. It's technical. Back in the day, I don't remember what year, Mr. Monahan will know, we decided to handle border state nursing home rates. And they came up with they were using, North Dakota, I believe it was, used the PA1 method. North Dakota being the whimsy place they are, they got rid of that. And so trying to be cooperative with our neighbors, we use their terminology, and their terminology is now obsolete, which we would say just about North Dakota at all. Mr. Chair, if we merged Minnesota with North Dakota, you know what we call it? Minnesota. Anyway, thank you. So that's the deal. I think it's technical, and I don't think it has any cost. I think it just keeps things going the way we want. There is a need for retroactivity, and so that's what I know. I don't know if it's going to cost anything, but maybe the department can tell us, and maybe they're using this method anyway. Thank you.
Thank you. Any further follow-up on the Senator Abeler A6? Senator Rasmussen.
Thank you, Mr. Chair. I was wondering if nonpartisan could explain, so what would this do to rates in these two communities?
Mr. Monahan.
Mr. Chair, Senator Rasmussen, my understanding is the changes in the bill would do nothing to their rates, that it is technical. The problem is the reference to case mix classification PA1. That classification no longer exists. So instead, they're putting generic language under the new classification system to refer to the lowest classification, whatever its code.
Huh. I love that. All those in favor of the A6 amendment say aye. Aye. Opposed, same sign. There it is. Senator Wickland is not with us right now, is she? Senator May Quaid, you don't want to do the A15, is that correct? All right, I'm Xing that out. Senator Abeler, we got to come back to, when Wickland comes, will you guys make sure the A8 gets in front of us? Because I might have to be in judiciary, but Senator Abeler, you got the A10.
Remember who brought this to me? Was this Ms. Simons or was that somebody else?
People handing out the A10?
Whoever gave me this, you want to come up and talk about it?
Who's? I don't see anybody coming up.
Maybe Mr. LM can explain it to us.
Mr. Monahan, would you help the good senator from Anoka?
Mr. Chair, Senator Abeler, I'll just first point out.
Yeah, sorry. Go ahead.
The original version of this request on page 1, line 12, the date was August 31st, 2025, which would have resulted in a retroactive effect for this language. So at Senator Abeler's request, I changed it to August 31st, 2026. Essentially, what it's trying to do is not have the ratio of waiver recipients versus other residents of a facility altered by the unfortunate absence on September 1st of a given year of a resident from the facility. A facility qualifies for this rate add-on based on the ratio of waiver recipients to other residents on September 1st. So if someone is absent on September 1st, they're not counted. So this allows for somebody to be temporarily absent if that is their permanent residence and they intend to return, they would be counted in that computation of the ratio.
Yeah. So thanks, Mr.
That's
Yeah,
good.
I'm sorry, I just had a.
Now you get it. Now you know.
Yeah.
Now you know who brought it to you.
Had a human service moment there. So the deal was, this disproportionate share program is actually rewarding assisted livings who actually have the ethic and the commitment to actually serve. And I'm only sorry that the threshold is so high, I think at 82 or 83%. But they're hardly, the people that are in the 70s are hardly even open. And many of the assisted livings have like 2 people, like a very nice place in Ramsey, city of Ramsey, which is where I got like a dog on a bone on this topic. The people could stay there and they could join elderly waiver when they spend down based on space available, which was 2. I won't tell you their name. But so this was a deal where the resident was in the hospital.
Yes, I remember this. Yep.
And I do not understand I almost used the curse word, Mr. Chair. I do not understand the antipathy, that's a better word, of whoever in the department does not like this program. I believe the governor of the great state of Minnesota has canceled this program in his budget, and I don't get it. So here's people who are, Mr. Chair, who are economically challenged, and they've spent down, and now they have nowhere to go. And as a way to encourage them, they would go to these places, but they're stringent with their work. There was even another case, which I don't know if maybe this will help them in the future, but there was an error in the paperwork, which the department had a part in, or the county did, maybe combined. And so they were within a half a person And then that person that just didn't count due to error, even though they were about to come in or whatever, then they were denied their little bonus.
Yeah.
And we should be doing all we can to open our arms and embrace this. So Mr. Monahan, if this is without cost, at least we can fix this for the future. And it'd be nice if there's a way to talk about the past, but I think at least going forward, maybe if you put on there a little phrase saying, would you please help these people who are so committed to the welfare of mankind and making no profits? They're the opposite of private equity, Mr. Chair. Would you please help them do it? That would be, I think, be consistent with the mission and direction of the Walz administration, and I think, Mr. Chair, every administration. So I think that's it, Mr. Chair. Thank you.
No, that makes sense. And I remember that it missed it by a day and ended up losing all that. No, this is good. Senator Zainab Mohammed, did you hit your hand up? Senator Zainab. All those in favor of the A10 amendment say aye. Aye. Opposed, same sign. Thank you, Senator Abeler. Senator Wickland, welcome back. We just going from one committee to another. You ready? You ready to go on your A8, or do you want to go to the A14 on Abeler? And Parachi, Radina, come on up. Senator Wickland. The A8's being handed out. Go for it. You know, you think as much money that they spent on this system, they could have given us some like bumper, not bumper music, but in this case, transitional music, you know? Would have been great. Yeah, I want some, anybody got any? You got some
Mr.
connection
Chair.
music there?
Mr. Chair,
Senator Wickland.
thank you.
You got
I
it.
just, I want to offer the A8. Senate Council has some technical assistance on it, and I'd like to have Mr. Monahan go over that technical assistance.
Mr. Monahan, from a Kantian perspective, please.
Mr. Chair, there's a drafting error in the A8. On line 3, the reference should be to line 13, not line 3.
Members, all good with that? Do I need to make a motion on top of the motion? Senator Utke's shaking his head yes. You want to just incorporate that into your amendment? Yeah, that works. Okay. Did you want, go ahead.
Mr. Chair, so this amendment came about, I have some bill language in Article 5, and I don't have the bill number, but it was a Department of Health bill that I presented in this committee. And my understanding was that the Department of Health has been working with the long-term care imperative, and I was given language that they had come to agreement on to insert in this section 29.
Yep.
And so I'm bringing it forward. I have also heard just recently that maybe there are concerns about the language, and so while I would like to adopt it today, I do want to continue to have discussions with the advocates, because I didn't realize that till today, so.
Mr. Chair.
Senator Abeler.
Well, I want to thank Senator Wickland for bringing this up. This restraint has been a problem since Fran Bradley, since I got here, to talking about it, and they would let people fall out of bed rather than be restrained and get injured. Some random, very few people had come to troubles because of restraints, the whole bed rail question and
Yep.
all that. So, but I think it just makes all the sense in the world the way you're going. If it's voluntary and the people are informed, then they would choose that. I have a constituent, And it's an old guy, and he's falling out of his wheelchair. Luckily, he's not in an assisted living, Mr. Chair, that they would leave him there. But so he's at their house, and this guy tends to slide out of his chair, and so his wife put a belt around him. The worker came out and said, "You're breaking the law," in their own house. Like, anyway, so this is very important, and Senator Wickman, I'm happy to support this on the floor and however long it takes to get this, so that people have the voluntary choice. Thank you.
Yeah, you want to go to Ms. Rodina?
Thank you, Chair. Thank you, Committee. Thank you, Senator Wickland. We're thrilled that we're getting close to finally having language clarifying the use of restraints in 144G license settings. When assisted living licensure was passed in 2019, this was always a gap that we knew we were going to have to come back and address. Similar to what we already have in 245D license settings, the restraints language in the bill gives everyone rules of the road when it comes to prohibiting or allowing certain types of restraints. The A8 is well-intentioned to help ensure informed choice, but as written, it's not clear enough. We're worried about a situation where family member 1 comes and talks to mom and signs up for bed rails or puts in a bed rail, and then family member 2 reads about bed rail risks and wants to take them off. MDH and providers need a better process in statute to help mediate and avoid this dispute. We're talking with both MDH and provider organizations and hope to find agreed upon language that works for everyone. Thank you.
Thank you, Ms. Rodina. Follow-up questions? All those in favor of the A8? What? Yeah, I don't think we got, you want to, Senator Wickland, anything else?
Mr. Chair, Senator Abeler, I was given information that we can amend it today, and then we'll continue to work on it.
I'm in.
And so-
Senator Wickman, I'm happy. I thought you were going to pull it, so yes. Now, the best thing is to have language that's moving, then people have to talk to you.
See, I was ready to make the motion to move the A8 amended as amended, right, as the oral amendment, and then I get, so I'm kidding. All those in favor of Senator Wickland's A8 amendment as amendment, say aye. Aye. Opposed, same sign, and passes. Thank you for your work on that, and this is bringing back some memory. 2019, I wonder who was the chair back then. Senator, you want Senator Rasmussen, you got one for us? You want to go to Senator Abeler's A14? What are you thinking? Go to Jim. Senator Abeler, you want to do your A14? If you don't have it, we can let's do Jordan's A11.
Thank you, Mr. Chair. I'd like to move the A11.
Awesome. Do you want to, as it's passing out, Jordan, you want to tell us what this is and where you, just give us a little.
Thank you, Mr. Chair.
Fits.
And members, this is language that this committee has voted on before. This would add in a prohibition from Optum using private data that was obtained through their work on behalf of the state in evaluating program integrity, vulnerabilities, and making policy recommendations.
Oh, I see what you did. You just took out that little section of that just says, it's like, Optum Inc. must not sell, share, or disseminate any private data as individuals under incidentals of their contract. Senator Wickland,
Mr. Chair.
we already passed it once, so yeah.
Oh,
Yeah.
yeah, I don't remember what we included, Mr. Chair, but is it just, it seemed, yeah, I thought didn't we already have a discussion about this?
Yep, we passed it.
Okay.
Because we remember
do
we
we
took
need
all
to
that, you
do-
two were thumbs up because he came over and was talking to you, so.
I guess
Yeah.
my question would be, why would we add this then?
Senator Abeler might have
Well,
that,
Mr. Chair,
Senator
we need
Rasmussen.
this, so this can be the most mentioned item in this committee in the year. I think we're within just a couple mentions of it, to actually have the most record of all time mentioned.
Optum.
So it's purely about statistics and bragging rights. I think we should do it.
Senator Rasmussen.
Thank you, Mr. Chair. And Senator Wickland brings up a good question. The reason I'd ask members to add this to this bill today is just to have this continue to be a part of the conversation on the DHS policy bill. And Mr. Chair, I'm not certain, what will be coming to the floor, what omnibus bills will be happening or not happening, or standalone bills. And so this will just serve as a marker that this is work that this committee would like to continue on.
Senator Wickland.
Mr. Chair, Senator Rasmussen, I guess the only thing I'd add is that it's still language that needs to be heard in judiciary, and we're working on that, so.
Mr. Chair, does this get sent to judiciary if we add this amendment? Because I know when we added it to my bill, it got sent to
I
judiciary.
think we need advice because you're adding it to your stuff too.
Mr. Chair, the full meal deal got sent to judiciary. We decided in our committee this is not.
This doesn't go. This is the section that
They can't
doesn't
sell
go.
what they learned. That's what I understand. Because we did add it on to something that went not to judiciary.
The health people at the end are thinking no. Do we have an opinion? What are you guys thinking?
Mr. Chair.
Senator Rasmussen.
Thank you, Mr. Chair. The reason that we specifically stuck to this language was based off of advice that the other language would necessitate a stop at the Judiciary Committee. Senator Latz can always, ask for whatever bills he wants, but this is the same language that was adopted on an earlier bill.
That didn't go to judiciary. This is the stuff that doesn't go to judiciary.
That was our aim with this amendment, was to carve out the items that would trigger a hearing in judiciary. So that was the intent here with this language.
I remember, I remember that. We recessed and then Sam went over to Senator Wickland and to Senator Rutke and explained everything. And I remember this, if we pull this out, that stops it from going to judiciary. So I'm okay with that. We're good? Oh, let them, they're talking. Let her discuss. So last week when we had the full bill that he was doing, we recessed and this part of it, because in part of that, in the bill, language would have caused it to go to judiciary. And so we pulled out this section at the advice of people smarter than us. This would not have to go to judiciary. And that's what they're having discussion right now at the end of the table. And if we accept it, we put this on and it doesn't need to go to judiciary. It stays with our policy bill. Yeah. Cool. Did I explain it? They are. The health people are mingling. You want to let them mingle? Senator Abeler, you want to go join the health people? The health people are mingling down there. We're waiting on them. This is where I want music. You wait till the A19 comes up. I'm looking for that. Steely Dan, how did he get that A19? What do you? We're good? You guys, okay. The health people have said we're good. So all those in favor of the A11 say aye. Aye, opposed, same sign. Thank you. So that's done. Jordan's A11 done. Senator Abeler, did your A14? 14?
Yeah.
You got it now?
Do you have the A12? Yeah. Oh, do a Glenn one. He's got the A12. Let's be sequential here.
Well, Glenn, you didn't tell us you had the A12. Now you want to go first? Yeah. Ladies and gentlemen, Senator Gruenhagen, the A12 amendment.
Yeah, the reason I brought this amendment, in the bill, there's a provision that prohibits nursing homes and assisted living. It prohibits residents from requiring, it prohibits them from requiring a guardian or conservatory for the resident. These are very difficult situations, and we need to ensure the proper protections of those residing in the facilities. This takes away any flexibility for providers when emergencies arise or to plan ahead in case of emergencies. Now, through my insurance agency and even my own family, I've been involved with some of these situations with memory care and other things like this. Unless I'm missing something, I don't understand why the state would completely take away the ability for a nursing home or assisted facility to require a guardian or conservator. Because, you know, many of these people have severe health problems or memory problems. And to me, it's a local control. And unless I'm missing something, what this amendment would do, it would remove this provision from the bill.
Do you remember, Senator? Thank you. Do you remember the provisions that you're removing in there? Do you remember whose original bills or bill that was?
I think it was yours. No. No, I think it was Senator Mann, if I remember right.
Okay. Senator Abeler.
You know, this has been a discussion for a long time, and some places, it's kind of back, this is the nursing home side, but like, you know, there's just some practices that have not been good about some requirements. And in fact, as opposed to control, now it's a requirement. Some places have a requirement. And then it takes away the ability of the individual to have some choice, if that's the rule. And I just remember that we had testimony about that. So I remember I thought that was something that they shouldn't be required to do. I think if we've had testimony in our committee on this topic over the last several years. And I would just speak against the amendment personally, so thank you.
Thank you, Senator Abeler. I would too. I would, yeah, I agree. I would speak against that piece, that part of the amendment, Glenn. So Senator Aaron McQuaid.
Well, thank you, Mr. Chair. And, you know, Senator Abeler said it very nicely. I think, you know, we veered from something that could be a conversation or something that could be, you know, part of an individual's entrance into an assisted living facility or nursing home, but now as a requirement. I mean, I'm thinking about what if it's the closest one to your home or to your family's home, and it's now a requirement, and you don't need this at all in any way, shape, or form. No one thinks you need it, right? It's just a requirement to have some assisted living support. And so I think we should leave this in. I think there's still the ability for assisted living facilities and nursing homes to have conversations with families, but we can't force people into guardians or conservatorships in order to have, you know, a little bit more support to make sure that someone's there if they fall. Like that's taking away a lot of agency. So.
And this also, this argument, some of it stems, I wish we would have I wish we would have started the session in January so we could have like ample conversation, because this conversation, Senator Gruenhagen, it also it goes to hospitals getting, you know, someone going to a long-term care facility, not having that go-to person. You're dipping on a bigger umbrella here that we need to really, I think, get under. So Senator Zainab Mohammed, and then to Senator.
Mr. Chair, I think we passed protections for HCBS last year, so why can we also just apply it to this?
Yeah. Senator Gruenhagen, then Senator Utke, unless you want to let Senator Utke go first, Senator Gruenhagen.
Go ahead.
Yeah. Senator Utke, go ahead.
Thank you, Mr. Chair. And I guess I would encourage the fellow members to support this amendment because honestly, when you go through this process, when people get to the time of needing assisted living in nursing homes, they typically need help. That's why they're going to those facilities. And to prohibit a guardian or a family member, or just, I would think that the place would really want it, because I can't imagine, I've gone through it with, you know, my parents and other elderly people that when they get to the time of the nursing home, they're going there because they need help. I think that this should be removed, and we shouldn't be part of it. I mean, it's an individual by individual type thing when you get to that age. Everybody's different, but just telling nursing homes are prohibited from this and assisted living, I think is wrong, so.
So can we, I got Senator Gruenhagen, Senator Wickland, Ms. Rodina. Do you guys want to hear from our state, probably forgets more in a day than any of us will ever know regarding this argument? So, Ms. Rodina, you want to clarify the room, will you?
Thank you, Chair Hoffman. Thank you, committee members. And I do just want to start by saying we are in discussion with provider organizations on this language as well. We haven't reached agreement yet, but I think we are continuing to discuss and appreciate that openness and willingness to ongoing conversation. To, I hope, address your concerns, Senator Gruenhagen, I think it's worth recognizing that this language is not a blanket prohibition on guardianship and conservatorship. It's simply saying we don't want to have somebody languishing in the hospital who could go to a nursing home or an assisted living facility, and that the person can go and we can have supported decision-making, or in cases where guardianship or conservatorship is appropriate, that can be pursued as well. So it does not stop that possibility from happening.
No, you're good.
I had one of those moments. Thank you, Chair.
Do you want to go to her first, because you're the author of this amendment? Senator Wickland?
Yeah, I think I would would reinforce what she's saying. It's not saying that a person can't have or can't have a guardianship or have a conservator, but the nursing home can't make it a condition of their coming there that they have that. I don't think they should be able to prohibit someone from coming to a nursing home or assisted living because they don't have a conservator or a guardian.
Got it.
So I would oppose removing the sections.
Senator Gruenhagen?
Yeah. Oh, I appreciate the discussion on this, and evidently from her testimony, it is a little bit of a bone of contention, and you are working on language, right? Yeah, I guess I wouldn't want to cut out from the discussion completely the nursing homes and the assisted living. I mean, some of these people have, worked with residents a number of years. They also have experience in this area. They should have some type of an input versus just a family member.
I was told one time, as an elected official, we have the power to convene, and that's it. So it sounds like you're interested in this conversation. It sounds like Ms. Rodina, I don't know when we would get to the floor, right? It feels like there's plenty of time, to convene some folks, and if so, bring an amendment to the floor. She's shaking her head yes. You're shaking your head yes.
Otherwise, we could add the amendment, and then it creates conversation. I heard that one in the past.
I think you got to split. I love this committee. We're split right now. This is fun. Yeah, I'm with Wickland, Abeler, Hoffman.
Mr. Chair, if we take it out, there will be no conversation. So.
But I still think, Glenn, no matter what happens here, please, this is of interest to you. In Ms. Rodina's office, I think y'all should get together with whoever else is interested. Maybe you could finally get Sean Burke to, do something.
So I'll defer to the chair.
And he's wearing a tie, by the way. Did you see that? Sean Burke is actually wearing a tie.
No, I'd like to work with her.
You would, awesome.
Yeah.
All right. Any other?
So should I just withdraw it, or?
Yeah, you don't want a position. No, Glenn, if you want, just withdraw it, but with the condition that y'all going to have conversation, and you're going to follow up. Keep us in the loop.
And we could still add it on the floor.
100%.
Okay.
Thank you.
All right,
Senator Gruenhagen withdraws the A12. Senator... All right, I'm confused. Glenn, you're done. The A4, did we do the A14? All right. Is there an A13?
That's bad luck.
Okay. We're going, no, A13 is an A14, Senator Abeler.
Well, thank you, Mr. Chair. This is, I didn't even know the acronym. This is BELTS. This is the board of something or other that runs long-term care, the administrators. And so this is just a rehash of, it's just a technical cleaning up their language about their fees. And so No, but there's no money in and out, but it's neutral, but I don't know if it belongs in this bill or the next one. So I was just going through my little inventory, I thought, oh, look at this one here. So if the staff thinks this belongs in the finance bill.
If it stays, okay.
So I don't care where it goes. I mean, this is the kind of amendment that if we discuss this very long, we'd have no people viewing online.
Does it stay here or go to finance? Yeah, that'd be great. Go ahead, Rick, Kyle. Yeah. Mr. Raymond. Mr. Raymond, does it stay here or does it go on to finance? Should we get Elise Bailey to come up too? And, you know, I'm kidding. Go ahead. What are you thinking?
So, Mr. Chair, I think the question at hand would be whether the changes in subdivision 2 would change any revenue for the Board of Executives for long-term, their LTSS. So this is, this executive board is defined as a health-related board under Chapter 214. So as such, any change in revenue wouldn't automatically be spent. So therefore, it wouldn't have a zero net effect. So if these changes result in any increase or decrease in the amount of revenue they receive, then therefore there would be a fiscal effect. I'll also note that the base funding for this board is actually under the Health and Human Services budget.
Senator Wicklund.
Mr. Chair, it appears that way, but that was only because last year in the other body, it was in their health committee, and so it got brought into our bill at the end, but it would be within this committee's, the board is within this committee's jurisdiction.
Huh. I love it. So we got the health
That's the way-
folks.
So, Mr. Chair, where do you want it? We can wait. I just didn't want to lose this thing.
Don't lose it. I
It's
mean,
not worth having a hearing about, you know. It's that boring.
you want to withdraw it and pull it out, or you want to stick it in here?
What do
and-
you want?
I don't know. Elise Bailey, what is this? Is there a fiscal on this?
This isn't her department.
It's not her. It's not
Get
you.
her up. She's come all this way. I think it's all technical, but Mr. Chair, if you're the least bit worried, we can stick it in the other one. So
All right, let's do it.
I'll just withdraw it.
Jim, Senator Abeler is withdrawn the A14. Members, the A14 is withdrawn. We got anything else? Jeez, somebody starts singing that song. Hey 19 by Senator Fate.
Thank you so much, Mr. Chair. I'd like to offer the.
Can you name the drummer in the Steely Dan band, by the way?
I have no clue.
Oh. Senator Fata, go ahead.
I'd like to offer the A19 amendment, and I can call up Matthew Bergeron if there's any technical questions or if it causes any indigestion, which I hope it doesn't.
Only if he's wearing a tie, because this is the Senate, and he did his, his due diligence down there. Senator Bergeron, or Mr. Bergeron, you want to come on up?
Yep, and while I'm explaining, so ICS, so this connects directly to the continuity of care that you're talking about this session. ICS settings, so when ICS settings close or providers exit. There you go. Can I do it while I talk? Or?
Yeah. We are now whole because we heard from the A19 of Steely Dan. So this is the continuity of care argument?
Correct.
Connection, tell me where this ICS conversation
So establishes
fits.
transparency in two areas. Actually, let me bump up a little bit. So when ICS settings either close or providers leave, individuals can lose both their care and their services at the same time. And it's difficult to manage because there isn't any transparent or up-to-date data on occupancy or available capacity, which makes it challenging for counties to identify like appropriate placements. And so the two ways that helps is, number one, it requires DHS to publish quarterly data on ICS capacity, which includes occupancy, available beds, and the number of operating and closed settings, applications under review, and then timelines. And then second, it requires DHS to publish standardized setting review criteria, application templates, and documentation requirements, so providers and lead agencies have clear and consistent direction. So I think it helps, and I can press it up to.
I like where he's going with the county side of it. Does it, because Luella, does that make sense to you? Is that she should look at this? You don't even need to talk because I already like it. I like the, but go ahead, Mr. Bergeron, if you want to add to what the good senator from Minneapolis was saying.
Mr. Chair, Senators Matthew Bergeron, Larkin Hoffman, on behalf of the Residential Providers Association of Minnesota. We've had conversations about uncertainties and confusion with the ICS program going back a couple of years, and Senator Fateh had a bill in front of the committee last year that was talking about codifying this program in a way to create some certainty. This is a small step in that direction and would just require some of these standards and the capacities to be published with a regular basis.
Thank you, Mr. Bergeron. So I'm being told there's an assumption that there could possibly, maybe, sorta, don't know, be an administrative cost on this. So what are your thoughts on that? What do you want to do? We don't know because we don't have, but I just see Elise Bailey shaking her head. She's never wrong. You guys know that. Senator Abeler.
She is just no fun sometimes.
Yeah. You guys didn't
These
give Senator Uckey
responsible
the question
parties that come to these meetings.
Oh,
opportunity to ask the question.
I'm sorry, I didn't give Senator Uckey. Senator Uckey should be asking that question. Is there a cost? There, Senator Uckey. Elise, would this make sense? Do you have an idea how much your Department of Administration? Of course, you probably have to run that through, Human Resources, which is controlled not by DHS, but by MMB. Did you guys know that?
If there's a cost, we can just take out a
They can just do it in their
Senator
break time.
per diem if we want.
Which
Yes?
they never get.
What are you thinking?
Chair Hoffman, members of the committee, this likely would have a systems and a staffing cost. We just don't have capacity to absorb additional reports or work. So we would need staffing to do.
Senator
what's
Rasmussen.
Thank you, Mr. Chair. And I would also see this as adding additional work on the Department of Human Services. And I would just say, especially in a time when I think all of us are asking DHS to focus on program integrity and focus on continuity of care and those issues, I just don't know if now is the moment we want to be giving them some more additional work. So especially if it would require more resources.
Well, that's the thing that go ahead, Senator Fatah.
No, when we talk about continuity of care, and I think that's been the theme this session, I think that this is critical, and identifying the areas of needs. And if we want people to get placed in services, I think this is the right way to do it.
Can you get a no cost? I mean, there's to the contextual argument that's there, because that's all this committee. We talk about continuity of care, right? We are, because it's go do this, but you're forgetting about the people. We have four people dead because of somebody's inability to do continuity of care. Is there a way you go and look at decreasing that fiscal cost side of it? I mean, what's the...
I can refer to, I don't want to say Senator Bergeron, Matthew Bergeron.
Chair Hoffman, members.
No, it's worth the conversation. I mean, I think there's a thematic argument here that I like. When he said that, I went, God, I like this. And then all of a sudden, I get oops, there might be an administrative cost to this. And then it's like, now what do you guys want? What do you want to do as a committee, right? So...
I would say, Chair Hoffman, I would say that, there's a cost because it's a function that you want the administration to do to assist people. And where we're at as an agency is we have a budget of 2% for admin. And, we could do better on continuity of care, but we don't have the resources to do it. So that's just my personal opinion. If you value that, put it in your budget bill and, up the game on continuity of care, including something like a report. But it requires people to do it.
Correct. You got to have accurate data. Senator Abeler.
Well, thank you, Mr. Chair. And I'm willing to posit that it might cost them something at the home office. But I think that this is something, especially this niche, which is like, I don't know, #2 on the hit parade for things that people are worried about, inappropriate services, fraud, that I think that we need to find a way to do this information. And so maybe I'm going to ask a question, but like we're asking them to publish the data. We don't make them develop, the standards. We just say publish them so it's obvious. I mean, that's something you probably already know. And, just I've got a 14-year-old grandson who could help you put this on your website if you need a little help. But but he's in Colorado, so maybe he's busy. But some of this stuff, open beds and so on, is a way to understand. And I mean, I'm not trying to talk you into free, but I think at some point the department wants to know this, in particular while there's literally probably tens of thousands of people whose care is being interrupted because of the efforts to constrain fraud. And the group, and the just not even knowing, like Lydia, they didn't know, and they're trying to help Lydia, who was displaced in New Year's Eve and has received no services to date, and her mom quit her job. And so it'd be nice to know if some of these beds are available for various people with various needs.
Yeah.
So like a capacity update. Yeah. So if the department has a safe transformation or safe something that they're trying to do where they've placed 77 people or something so far, I think we should find a way to pay for it and even expand on that a little bit. So, and I think that'll help. Otherwise, I don't think Elise could take the pay cut to absorb this. You know, that'd be wrong. So let's pay her full pay. So I'm in favor of that too. Thank you, Mr. Chair.
Thank you. You two are sitting over here working on something because I can hear the conversation. What do you find? What are you doing? What are you thinking? It didn't work out. What do you guys want to do? Have them work on it? No, we can't. I'm getting it all. So, all right. Do you want
the budget bill coming in a month or something?
Yeah. You want to withdraw and work? Can you guys work on this and then? I mean.
Yeah, we could work for the budget piece and then.
After all, there is some money that has been underfunded that's sitting in the general fund. Maybe we could do a little, I don't know, forecast grab and try to find some way to pay for some things. We would never, this committee would never do that.
Nope, that would never even be an effort.
I've never seen you do that ever.
I got the two health people laughing down there. Well, you made us pay for something 3 times. Do you remember that?
Chair Hoffman, for the record, we finally got it done. So you're not fixing that this year.
All right, Senator Fata withdraws his motion and he promises, Bergeron, do not go away. You're going to be working on this with him. So appreciate your help on that. So that's all I got. Utke, you got a couple, or is that in the next bill?
Mr. Chair, I don't have any amendments, but I do have some things I want to talk about when we get to that point.
I think, I think we're on third reading on this one. You having another amendment? For this one or for the next one? No, the next one you have it for. Because then what we'll do is after we decide what to do with this bill, then we'll take a 15-minute recess so we can go grab lunch. But we won't be going to certain places where other people have gone and they've made the news. Stay out of those certain places. Senator Utke.
Thank you, Mr. Chair.
Table's yours.
Thank you. And, I've got a question that is going to involve the Department of Human Services. So if whoever wants to come up here, it relates to, it's going to start on page 7, line 10, Department of Human Services, under the continuity of care. And it's a funding issue, so that's where my question is going to go.
I see that, subdivision 2. You're looking at subdivision.
Subdivision 2,
Yep,
right.
got you. All right.
And it talks about
Page 7.
Starting on page 7, line 14, we got within existing resources, a commissioner must ensure the continuity of care team always has sufficient staff capacity and resources for timely compliance with the requirements, et cetera. It goes down through, but then when you get to page 8, and we start to talk about some of this extra stuff, and then going to line 20, continuity of care team and lead agency shared duties.
Yep.
And this subdivision applies to all lead agencies regardless of whether the lead agency provides case management directly or under contract. And then you get down, starting line 829, if the lead agency fails to develop and implement a person-centered contingency plan, then you drop down a little bit more. The continuative care team must directly intervene and provide case management directly to the client at the lead agency's expense. And that's my challenge right there. I want to know, will any of these costs be passed on to our counties? And what can and should they expect? Because that's the concern that's out there.
I love that question. I love the fact that he brought that up, because this was the stuff they're already doing in Luella. This is stuff, I'm looking at Luella, this is stuff that remember, we codified this because a lot of this was stuff they're already doing. But yeah, when you see lead agency, to that point, Senator Udke, is there going to be some expanded cost to the lead agency, or is this just, the fact is the lead agency's in charge anyway, right? We're just assuring that they're in charge. Does that make sense?
Yeah, Chair Hoffman, Senator Udke. Yeah, looking at the language, which I admit is the first time I'm looking at it, it does seem to say that in the event that the DHS has to step in, that it would be at the lead agency's expense. I think we would need a fiscal note for this in order for us to kind of think about how we would operationalize that and how it would actually work, how the funding would flow. But, you know, my initial reading of it, and I see Luella is up here to provide her feedback. My initial reading of it is that in the event that we have to step in, there would be some sort of financing transaction related to that.
Ms. Luella.
Thanks, Chair Hoffman, members of the committee. Luella Koffer, Senior Department Administrator with Hennepin County, and I'm also involved with MAXA. The particular provision that I wonder about, not extra, but where there might be an expense to the county to pay the state for services. So, Chair Hoffman, I hear you when you're saying much of this is about what we're already expected to do. What the case manager would do is planning to have a contingency plan, look for alternative services, do the work that county or a contracted case manager would be doing. But on line 831 and 832, it specifically says that if that plan doesn't happen in time, so let's assume this is the case where folks have been working on a plan and the alternative services weren't able to be in place in time for the transition, then the continuity of care team must directly intervene and provide case management to the client at the lead agency's expense. It's that particular line where it sounds like they get involved and then we need to pay them for the services they're providing. So that would be my concern.
That's a could. Yeah, I see that could. And this also, what this helps, the thing that I asked for all session when I came back, somebody needs to take the lead, right? And remember where I live, there was a certain cluster of homes and everybody was pointing their finger who was in charge, right? And I remember Representative Newer from the other body was saying, the county lead agency must be the ones that, I mean, so this is, the intent was to get to codified. If that piece of it, Senator Abeler, you want to address that? This was something that was talked about.
Oh, this is really important, and I'm glad you got this in there.
Yeah.
But I don't know why we have to say at the lead agency's expense. We already pay for case management.
Yeah.
So I think that going forward, I think we should wordsmith this, that they would then be responsible for case management to do the service, and then they would be able to bill and pay their staff. So,
and that was the intent.
I think that's
the whole conversation was about that. You're spot on. So
and I don't know if you want to take it out right now, but I think that I think you want to just take that out on the floor and clean it up, and Mr. Monahan can think through about how it would be written, and you can work with the counties, because there's no reason the case management is not a finite amount of money. It's pretty much what you need for whoever's doing it. That's my advice.
And they're already the ones, to your point, they're already the ones that are being, that's the funding for case management is through that lead agency.
It's out there. If you want to do it, you'll get paid by the county.
Correct. So Senator Udke.
I mean, no, by the state. The state will pay you.
Yeah, correct.
Via the county.
Yeah, via the county. The county is the lead agency in this case. So,
Mr. Chair, and that's exactly what the feedback I got from the county is they want clarity so that they know what this really means. Right now, there seems to be a little gray area to it. And they need to know what the rules are. And, you know, when it comes to finances, they're used to the state dumping a lot of stuff on their plate, and this caught their attention, so we got to make sure we know.
I believe this committee last year actually protected the taxpayers of counties, and do you remember that? We could call ourselves the, what were we called ourselves?
We were amazing.
We were.
We all just got our property tax statements, I believe, this week, and we see what gets put on their plate, and we get to pay for it. So that's why they're concerned and want to make sure there's clarity, so.
So, two things in front of us, Senator Atke. We can either fix it now, or we can have you and Mr. Monahan and, I suppose, Luella and somebody from the department get that clarifying language and we put it on the floor without losing the contextual arguments there, but if that little thing needs to be.
Right, I didn't have any amendment or anything in mind at this point, so yes, we can work on it between now and the floor. I just wanted to bring it up because the counties want clarity on it, and the conversation is good, and now we can work on something for the floor.
It was a good discovery.
Yeah.
Thank you.
So
You should be a lawyer.
I think that there could not be a better team on that than who's going to do that. And so I just want to remind us all again, I'm told there's 540 providers sitting in the AG's docket with 16 investigators. If they each have 20 people, that's 10,000 clients. And it may well be more than that. So this is not a if they're going to have to figure this out, it's when.
When.
And these people are being shut down today, and the departments, somebody thought they should provide services for 60 days with money they do not have, which is impossible. And so getting our arms around this is not just suddenly a random thing, it's a real thing. And so
it's a real people.
We don't want any more people to come to harm, so thank you.
Chair Hoffman.
Thanks.
Yeah.
I would say realistically, we need more people at the department to adequately get at that demand that you're speaking of.
Well,
I know
I'm glad you brought that
within
up.
available reresources, we're trying our best, but the reality is we don't have enough human beings.
It's interesting she brings that up, team, because we had given money to hire folks, and then I'm finding out that they can't even, the human resources department can't even get, not job class, what's it called? Not job descriptions, but job classifications done, and that it's not the department that controls human resources, it's MMB.
Wow.
If that's a true statement, then all the work that we've done is getting held up in another bureaucracy instead of the one that's in charge of doing what they're doing. Now, I make that assumption because of what I had heard.
Yeah.
And I absolutely believe who I heard it from and why I heard that is absolutely factual. So, for example, there isn't job classifications for individuals that are working in certain departments within the Department of Human Services because they're waiting for human resources to do it. And HR is run by MMB in that department. Go figure that one. I'd rather listen to Steely Dan than that.
Mr. Chair?
Mr.
In the
Senator.
meantime, what if we, DHS would hire their own case managers? We don't have a budget for that, so then they can.
God. All right, so Senator.
Thank you.
Thank you. Senator Atke, you have this committee's commitment that you will work, and we got a little bit of time on this, so thank you. Any other comments about our work? I am just absolutely proud to be a part of this committee and the work that we do collaboratively, and that there isn't any mediators or posturing or, except Glenn threw a pen at me one time, so that works. Senator Abeler.
Mr. Wedlick has been very busy at home. So a good cause that he found some definitions, and I won't read the whole thing, but so if we need to put this together, there's already some statutes that talk about it, but he referenced a good cause. It's a verifiable circumstance that prevents a recipient from completing the renewal process, et cetera, including acute illness or hospitalization, administrative delay, pending documentation, notice non-compliance. And so we could easily stick that in there somewhere or reference wherever the heck it is. So that's easy to fix.
Do you want to direct Liam to do that before? Like, we could direct for that to happen.
What if he just feels like doing it? We don't have to tell him to do it. Would that be okay?
I don't think he can do that. And he knew the answer to that. You know that? It's just like we all know the answer to that. So if that would be suitable, this committee, when we do our amendment, would have Mr. Monahan clean up no, not going to do it. Got to do it on the floor? All right. Got it? No, not now. No, on the floor. We'll do it for the floor. Okay. Senate File 476 as amended on the amendment should be passed and recommendedly sent to general orders. All those in favor say aye. Aye. All opposed, same sign. It passes. Thank you for your work. Let's take a little 15-minute recess so we can flip to get to Senate File 4222 and everybody got their stuff ready to go. So. Thank you. We're back.
Mr. Chair,
Senator Utke.
does your watch have batteries in it? I was going to suggest you get them checked.
Yeah.
Thank you.
Oh, I'm sorry. Sure. The guy who would ask about, yes, thank you. I appreciate you. Always had. I'm sorry. I was on Senate time, since everybody wants to make fun of Senate time, right, Senator Utke? We're like, where's my batteries? I'm looking at yeah, you got me. Senate File 4222, we're going to hear the markup of this bill. This was Senator Abeler's bill that we had into Senator Wickland's committee, and then, but what we did is we're bringing it back to us. I'll end up taking it over as chief author, and then our intent is that this becomes the vehicle bill for integrity legislation. So really what we're doing here is we're going to add member amendments to it. This gives us time, Senator Utke and team, to really spend the next, I think, couple of weeks working on this, right? So it really, like Senator Bach used to say, guarantee. I'll guarantee you this, Senator Gruenhagen, this bill will look different than it does going out of here today because everybody will be working on this, right? And so Senator Wickland and I would like this to be really a start of a collaborative on program integrity conversations between our two committees. Isn't that kind of a cool concept? When we return from the break, our plan is to put together and hear this package between both of our committees, and then take that work product and amend it, all the work product, and we'll amend that into Senate File 4222 in finance. So it's a hope that we move this bill into finance, which it does have to go to finance, and then we can go from there. So questions, comments? Senator Rasmussen.
Thank you, Mr. Chair. My preference would be, that there's a lot of new language that's especially been posted in the 810. I don't know if that's going to be moved to be adopted, but there's a lot of new language in here, a lot of language that hasn't been heard in this committee. And I don't, just given the timing that this was posted this morning, I don't know if members of this committee, I can speak for myself, I have been able to review parts of it, and there are parts of it that I like, there are parts of it that I have concerns with, but I don't feel comfortable moving a bill out of committee until this committee has done the work. And I think on an issue like this, that's especially going to have finance pieces, I think this is something that we could wait, we could work on over break, after break, have a fuller markup in this committee on this bill, and then move something out. But today, I don't know if it's the right approach to be kind of throwing in a lot of new language, a lot of new ideas that we haven't gotten testimony on, and then hoping it gets fixed later on.
So I'm glad you brought that up, because here's the intent. We are going to hear the A10. Senator Abeler's bringing the A10, delete everything amendment. But this, what we want is we want to send this as a placeholder, right? Senator Wickland and I want this to be the start of that collaborative between, just specifically on integrity conversations between our two committees. And my desire, Senator Rasmussen, was to have everything into this bill then, right? Because we're sending it, it's going to be marked to go someplace. Then we are working on it by the time we get to that place where it needs to be, because it's going to end up coming back to us after that goes to that one place, or it might go to Senator Wickland's committee. We don't know. We just know we want to not have, we want to avoid, I do not want to go to rules and hold this up. And that stops us from having the work that we're having. So I hear you. I think our timelines are the same, just the process on doing, I think you and I probably disagree on that in this one, which is great. I mean, that's what this committee does. We agree or disagree. There's a song about that too, isn't there? Oh yeah, it was like Senator Rasmussen.
Thank you, Mr. Chair. And I would also just note this bill is going to be a late bill at 5 p.m. today, regardless of what this committee does, and that's because the House companion's not moving. And so I think that shows that we do have time to work on this and to make sure we get it right. I think there's a lot of really important work for this committee to do on the topic of program integrity and on the topic of due process. And I just think we should, especially since there are some bills in here that have been heard and acted on favorably, but there's also a lot of new language that hasn't been heard by this committee yet. And we also know there's going to be a financial element to this as well, which I think would put us out to the third deadline.
Okay, well, yeah, that's why we're going to finance with this one. That was the intent. So no, to those points, those are good. Senator Wickland, Senator Abeler, Senator Utke, Senator, yeah, we can go if we can just start getting into the discussion of it. If you guys don't have anything to add to the conceptual process, Senator Utke does.
Oh, yeah. Thank you, Mr. Chair. And just following up on that, I know that, we have members that want this to go through, but the thing that I'm always concerned with, and we've seen it so many times in the past, is we'll just push something through because we're going to fix it later. Well, it never makes it back to the shop to get fixed. And we have time. We've got 3 more of our meetings that we can have before we actually hit their deadline. I think we got time to put this in its proper place.
Okay.
And not slow up or anything. I mean, we can add the amendments to it today or whatever, but I think we should still keep it so that we can really make sure it's what we want. Because, when I hear concerns about some of the things in it, and I know that Senator Abeler's brought everything forward in good faith. It's what he believes in, and I appreciate that. But then I have others that have concerns with it, and I think we need to work those issues out around this table before we send it to someone else.
Interesting.
Just my thoughts.
No, your thoughts are good. I think we're on the same process, thought pattern, just how we're doing it. I saw this as a time for us to just put everything, it's that ideation moment where you put everything against the wall and then you sit back and you got time to do. It's kind of like there's a certain senator on this committee that decided to Rule 21 one of our bills in this committee, and I was like, I was smiling, and he said to me, "You mean you're not upset?" I go, "Are you kidding me? You just bought me another week of time to work on something." So it's like, I think regardless, the work on it is everything. So I think what we'll do is, Senator Abeler, when you're ready, that's the only, are there any other amendments that I see people adding to this? I think the answer is yes. You got one, Glenn's gonna have one, and Utke, I think you got only one, I thought you had 2. You got just one? Just one? I think Zainab, Senator Mohammed has one. Rasmussen, you got a couple. So Senator Abeler, after your A10, then we can go to the other folks.
Well, thank you, Mr. Chair. I'd like to move the A10, and I do have an oral amendment to offer. And Mr. Monahan's going to help me offer it. Just adds one more person to a stakeholder group.
Mr. Monahan, when you're ready. Nice to see Dominic Spazzetto come out of retirement and hang out in our committee today. Look at this.
Is he here?
It's right there.
Whoa.
Where's the mortadelle, man? You're supposed to,
Has he been in Florida? Wow.
Mr. Monahan, when you're ready.
Mr. Chair, members, Senator Abeler moves oral amendment. Page 16 of the A10 amendment to Senate File 4222. Page 16, line 29, delete 7 and insert 8. Page 17, line 3, delete and. Page 17, line 4, delete the period and insert semicolon and. Page 17, after line 4, insert 6. At least one member who is an individual currently receiving services, period.
Thank you, Mr. Chair. That's my motion. And you can vote on it or I'll incorporate it, whatever you're more comfortable with, Mr. Chair.
You want to just add those into your...
Yeah, sure. Yeah.
All right, so Senator Hager, I love that those, thank you for getting the and in there.
Yeah, that's Mr. Berg's work. So, Mr. Chair, to comment, and I think if I can have Mr. Bergeron come up and fill in the blanks about what's new since we last saw the A4. It's not a massive amount. And so we heard the A4. We've had hearings on this in both committees. There were, I don't remember the bill numbers, but Senator Mohammed had a bill. I had a bill with due process. There was a good no bill. There was your bill, Mr. Chair. The OIG had their policy bill.
Yep.
And there was one other one.
Yeah, we had...
There's one more that I forgot. Anyway, so this is a very equal-handed, without a lot of judgment, stuff stuck together. And with the exception of on the Senator Mohammed bill with the EVV and the numbers, there's openness to that if there's a way to make it work. And the testimony was that what was there wasn't workable, but if there's a place to add EVV in where it makes sense, I think that's certainly beneficial. And with the numbers as well. The question about numbers at like nursing homes or somewhere where there's just people working all day on a kind of a daily rate or something was problematic. So if there's a way to actually make sure we're tracking the right people, but except for that, with that two exceptions, everybody's stuff is put in their compliance training and even so there's quite a bit here, and it's in all those bills there was a lot of really solid ways to do program integrity and minimize fraud. And what's been lacking has been the chance to have some due process. And in working with the department, and Senator Rasmussen has an amendment that even allows for a third party to look the thing over within a period of time. Because what's been going on before is that there's been just languishing of these individuals pending the Attorney General and so on. And so I don't think even much this bill is splitting much of the difference. It's very inclusive. And with even the first comment by the department, then I'm happy to accept that, which we think it helps. And I think the committee has to decide, are we going to be in charge of this as ourselves, or are we going to fall into some big lump of finance bills that are going to go forward, or maybe one bill? And I think on behalf of the public, I think they want to know what we're doing. I think part of what the error in this process has been the lack of transparency The prepayment review popped out, and that was a surprise to people. And, you know, some of the rules around the credible allegations of fraud, what standards make sense. And I, for one, am very interested to sit down with the, you know, Mr. Clark and the department and the providers and find a way to make this work. The providers actually provide a wealth of information about how to keep it good. And so by bringing in good provider practices with that view, then we can find the ones that are not good. And so that's the point of this. And so that's just my opening thoughts. And I think we're well on our way to a really, really good bill. I think we're far ahead of the House, the other body, on this and the work that we've done with the integration of all the people, all the different interests.
So thank you for taking that on, because this was a conversation that was, we had all these different moving pieces out there, and
yeah.
I appreciate you on this committee. You went and collaborated it to get us having the conversation, and so that's appreciative of that. So thank you, Senator Abeler, for doing that. That's committee work.
Oh, yeah, thank you. I asked Mr. Bergeron if he could walk through the new additions that came out of those two memos and that were posted somewhere along the line. But and some of these reference federal standards, which I think are healthy. And so if that's okay, Mr. Chair, I think that would be productive.
Senator Aaron May-Quake.
Thank you, Mr. Chair. Just so, I'm sorry, I was also next door in state and local gov. This is just a new bill, and we're about to walk through it. Am I caught up?
Yep. Senator May-Quake, what we had done is we'd taken all the integrity conversations and we attaching it in here. Senator, she's not here. Senator Wickland, we want to do a collaborative, the Wickland-Utke world and our world over here, we're going to then work together to have an integrity bill. And the desire is to get this to go to finance. It gives us now time then to clean up. So whatever's in there now, I mean, this is just a baseline. We're going to work on this. I mean, we are going to work on this.
Well,
so,
thank you.
Senator.
Sure, just for Senator May-Quade's benefit. So the A4 amendment was pretty well transmitted around, so people kind of know that one pretty well. But so Mr. Bergeron, and there's some additions to that we were working on as refinements. And so he's just going to talk about those, the additions. Thank you.
Senator Zainab Mohammed, you're good? Answered, way to go. Mr. Bergeron, I'm so glad to see you're wearing a tie in the Senate. This is so wonderful to see you in front of this committee. The mic's yours.
Thank you, Mr. Chair. Senators, my name is Matthew Bergeron with the law firm of Larkin Hoffman. I'm here speaking on this today as a practicing healthcare attorney in this space who represents a variety of different types of Medicaid providers providing services subject to the Department of Human Services program integrity oversight, licensing, and provider enrollment standards. In reviewing the various proposals that Senator Hoffman referenced that have been kind of compiled into this package before, there have been a number of things that we've tried to offer a little bit of feedback or notes. Some of them have been incorporated into the A10 here. Some of them, I think, are conversations that are still ongoing. With respect to a lot of the pieces on provider enrollment, there's a lot of really valuable authorities, I think, as far as ensuring enrollment standards and raising thresholds for providing services in here. The primary note that I've provided in that sense, there's language regarding moratoriums and on classifying services as high risk. Kind of my recommendation to Senator Abeler and to the committee is that in those instances, the legislature require that those changes, those policy decisions, follow the Administrative Procedures Act and be done through some form of rulemaking. This is how you ensure that they're valid under our separation of powers. The legislature makes the law, the executive branch enforces it unless the legislature delegates that authority to make rules to the state agency, and then we have a process under Chapter 14 where that's done. And I think one of the things that we've seen in recent months, but over years as well, is that authority that's not executed through that administrative process can become confusing, does not necessarily receive the public input that the administrative law process sets up. and also is subject to legal challenge where if done otherwise, it wouldn't necessarily need to be. As it relates specifically to the program integrity, and I want to note that the Department of Human Services has provided some significant feedback to some of the language in here, and I think a lot of that is actually in an amendment that the committee might be considering, the A11 at some point in this. And so I kind of want to speak a little bit more about what that looks like, because I think there's some recognition. One of the historic situations has been that when the agency issues a temporary payment withhold for a credible allegation of fraud, because that is a temporary payment withhold, it's not deemed a permanent adverse action, and the courts have held that there is no due process rights, there's no appeal rights, but there's also been nothing in law that has ever established what temporary means. And so I've represented clients over the years that have gotten a temporary payment withhold, and it has gone on years with no subsequent investigation, sanction, criminal case, or anything like that. And so that means that business, particularly if it's a service provider that's just delivering Medicaid services, is long since out of business. I've had clients that I represented one agency that got one temporary payment withhold. 11 months later, they got a letter saying, "We've completed our investigation, you're okay." Well, that agency was long gone. There was an instance just this last October where after 2 years, an agency sued, and roughly 10 days after they brought their suit in district court, they got a letter that says the investigation's complete, no fraud, you can resume. And so one of the things that the language in the A10 would seek to do is ensure that there's some mechanism whereby somebody outside of the Department of Human Services looks at a situation and determines whether that allegation of fraud is in fact credible, and then tries to put some parameters on the timeline definition of what temporary means. In hearing the feedback from the Department of Human Services, they expressed concern, because as the bill was originally written and as the A10 was, or is, that would be a contested case hearing, just like a licensing violation or a take back. And in that, you've got a process called discovery, whereby the parties have to exchange documents in order to be able to argue the case. And the department has, not to speak for them, but has raised concerns that if they're investigating somebody for fraud, that would require them to share information perhaps too early in the process with a potential criminal defendant. The feedback we've received, and that we are happy, the provider community that I'm generally working with thinks makes sense as a good middle ground, is what is called an in-camera review, where something is submitted to a judge to review, but the parties don't necessarily get to see it, right? It's submitted under seal. And so again, the idea there being is that there would have to be some outside third party. In this instance, it would be an administrative law judge at the Office of Administrative Hearings, just like might be handling a licensing appeal, just might like be handling an overpayment take back or a fine appeal or something like that, who would look at the department submissions, would look at whatever was submitted by the provider and determine whether the allegation of fraud was in fact credible such that the withhold should be sustained. The provider wouldn't get to see what the department had in their process there, and so I think it tries to get at that. But that review or appeal is kind of like the first step, is making sure that there's some outside third party, because under current law, the agency can submit information and say, hey, we think you've got it wrong, but there's no one to look at it. The department is the sole arbiter as to whether their allegation is credible. The other piece in this that is worth noting that is new is some parameters on how long temporary is. Because at some point it becomes a permanent removal from the Medicaid program, which otherwise under law would be subject to an appeal. The language in the A10 would establish a 60-day window that could, again, by an administrative law judge under seal, be extended up to 2 more times, up to 6 months, 180 days, if there remained a credible allegation and an investigation was ongoing. Those timelines are a starting point for the conversation, but the big point of it is that if a payment withhold is imposed, services are interrupted, workers have to change agencies, individuals have to seek services elsewhere, the ball needs to keep rolling. And ideally, that within that 6-month window of time, even if the criminal case was still in development, the department would be able to identify something, whether it was a licensing violation or other conditions of participation that would allow them to move to either revoke the license or terminate their Medicaid enrollment while still doing, that wouldn't forestall a future criminal fraud prosecution by the Attorney General's office. And so that language in here creates some kind of timeline as to how long a temporary payment withhold can exist, because while I fully appreciate the Inspector General's comments recently about the workload and capacities of both the Attorney General's office and the Inspector General's office in the current moment in time, historically we have seen these go on for years and never be resolved, and so that's one of the other issues we're trying to address at the moment. So I think those are the high-level differences based on some of the broader provider feedback and some of the pieces that you'll see in here. But like I said, I do want to note that there's a potential second amendment that has been shared that I think would move towards the department's preferred language on a in-camera review, and I think that's something that the providers understand and are happy to kind of move and work on.
Mr. Chair. Well, thank you. And I appreciate that. I appreciate the work that's there. And I, want to just note the people that have put some effort into this and the work. Senator Hoffman, you have a couple of bills here. Senator Muhammad has a bill, and she's done a lot of work in the meantime. And I think that the process we've been using all along, Mr. Chair, in this committee where we've included, everybody's work. This is not my bill. Most of the content here is not mine. I just tried to collate it together. And as you know, Mr. Chair, then it's now your bill, and I thought it would be in the best interest of the work that you chair it. And then in consultation with everybody on the committee. And I think that everybody wants to work on fraud. But I think the people on this committee, along with she's on that committee too, Senator Whitman, are the best suited of anybody in the Senate to create a really good Senate position. And so
absolutely,
I'm
and
really
this makes sense because you start a baseline, you're exciting, you're bringing it together. We are going to have time to work on this. That was the intent when we were talking about with Senator Wickland. How do we have something that is going to look, like it's like in the work on it? And so
and I forgot to mention Senator Fate and Rasmussen. I mean, we're all going to have a piece of this. There's more amendments coming in.
There's a bunch of amendments going to get added to this. So right now, we're just going to start with the A10. So all those in favor of the A10,
Mr. Chair. Mr. Chair.
Yeah, to the A10?
Yeah, Mr. Chair, I guess this would be a question for Mr. Bergeron. Mr. Bergeron, the language that you've spoken to, has that been introduced in a bill?
Mr. Bergeron.
Mr. Chair, Senator Rasmussen, the idea of an appeal as it relates to a contested case hearing, or the in-camera review.
If I look at like Article 1, Section 10, Article 1, Section 11, a lot of the language that you've been working on, has that been introduced in a bill that's been heard in this committee?
Mr. Bergeron.
Mr. Chair and Senator, a number of those pieces come from a package that Senator Abeler had in committee last week, I think it would have been. A couple of pieces related to that 60-day kind of continuation, that definition, that is new here. And that was feedback that was offered in reaction to that bill's hearing, I think a week ago Wednesday.
Yep. Sounds good. So the answer is yes. Senator Rasmussen.
Thank you, Mr. Chair. And I don't feel comfortable adopting the 810. I think there's a lot of good stuff in there, but I think it needs more work. I think we need to have it.
My question to you is
available.
this: I'm getting a little triggered because it's late in the day, right? Our committee has always moved stuff processed through. I don't know what the holdup is on this. The A10 gets us in the process through. So I didn't mean to cut you off, Jordan, but I just am like trying to. If the A10 isn't adopted for us to start the work with Senator Wickland, then what's your proposal then? So do you have another amendment you want to add that would strip the? I mean, it's just I don't care what's in the in the bill right now because the real work's going to start from us once we get moving toward finance. I don't want this committee to go to rules. That's the only thing. That was my whole desire and dream. So I didn't mean to cut you off, Jordan, but I was just like,
Thank you, Mr. Chair. And
No, I appreciate you.
I respect the work of this committee, and that's why I think we should do this hard and important work here. And in terms of avoiding rules, sending this bill out of the committee today does not solve that problem for you, because the House companion bill is not moving. It was heard and laid over. This Senate file isn't going to become law. And so the even language that we work on that goes into this is going to have to become a part of a different Senate file, which means that we do have time, to get it right in this committee when we can hear from testimony, when we have time to read through the entire amendment. The A10, I think, was posted this morning, was finished last night. And I know there's lots of similarities between that and the A4, but that's been my big thing, is even trying to map it and understand what is in front of us and what would be some of the things we'd want to change.
I get it. Your approach is different than my approach. It's fun. It's just because we're having the same conversation, but the approaches. It was kind of like when Ramstead was asked about, is it Bush or is it Edwards? And he said, well, they're both going to balance the budget. Just their approach to doing it is going to look different. In this case, your end game. I think the end game, what we're trying to get to, is more efficient through this way of getting it and then working on it. That's just my style of doing it, right? Where your style is you want to sit here and do this and then start adding little pieces. And I don't know if we have enough time to do that, Jordan. I mean, I think us getting people working on it after it's all together makes more sense to me, but I'm okay. I hear you. And then we'll go to Senator Zainab.
And actually, I would point out something that Mr. Bergeron said, which is we do have, there's this A11 amendment where there actually has been some back and forth and I think some agreement on how we could incorporate due process. But the challenge is that there's so much going on in this A10 that to try to synchronize everything today, I don't know if that's possible. And so that's why I think this committee should continue to do that work.
And that's my intent, was to throw everything into this bucket.
Yep.
Then we go to work on it. Then we have it ready to go, right? It was to give us a baseline to start working from. And that was the intent. You would do it differently than I do it, but that's, I get it.
Yes, yep. I think we understand each other.
Yeah, we do. I completely understand, and so I get it.
Yeah, so I just want to say that I don't think we should be adopting the
I get
amendment
it.
here today.
I get it. Now that you've explained that, I thought, was he trying to just kill this bill for the sake? That's what I was actually sitting there thinking. But no, you want the end product to be the same as our end. What I see the end product, just the process is going. There's two different ways. I love it. Thank you for talking me through that, Senator Zainab Mohammed.
Mr. Chair, maybe this is for Matt. Maybe it's for council. Can we just go through the parts of the bill that have not seen a committee yet in the Senate?
Mr. Bergeron, do you have an answer to that? Senator Mohammed would like to know which parts of this A10 were not heard in this committee.
Mr. Chair, Senator, I'm more than happy to point out a couple of the more substantive pieces that I had made recommendations or had suggested that I have seen in here.
Just to tie it together.
Yeah, and I just don't know that I'm in a position to guarantee comprehensive nature of that because I didn't draft it, so I would defer to Mr. Monahan on that. But the two things I can point you to that are in the A10 that I know were not a part of Senator Abeler's previous iteration on some of these program integrity pieces are Section 13, starting on page 12, the time limit payment withhold. That is a new concept, and that was not in front of the committee in last week, and that is the 60 days extendable up to 180. That is new. And then Section 14, the good cause language, that is new in a bill form in front of you in this conversation. That is almost exactly the federal regulation dropped in, so it's not new law. There's one kind of minor fleshing out of a concept on page 13, line 15. Yes, line 15. But otherwise, the rest of that section is existing federal law. The language on page 13, line 15, just kind of clarifies that, if you look at page 13, line 9, where it says beneficiary access to items or services would be jeopardized by a payment suspension. And then it lists out some of the examples of that, and those are all federal law. This would add an individual or entity operates a provider-controlled residential setting for which individuals are reliant on the entity or on the individual entity for services. So it kind of fleshes out a little bit there, getting at some of the continuity of care conversations we've had in the past. But otherwise, the rest of that subdivision 2G is the federal regulations. So it's existing law, but it's new to the committee in form of a state statutory proposal here. Those are the two major ones that are additions or fleshings out of some of the materials that Senator Abeler had, but I would of course defer to Senate Council for a number of the other smaller pieces, but those are the two major topics.
Mr. Bergeron, do you know how you arrived at 60 days for page 12, line 12.18?
I'm sorry, Mr. Chair?
I think the new language states 60 days, how we arrived at that number versus other suggestions.
Mr. Chair, committee members, that was a right, 60 days that could be extended twice up to 180 days, 6 months was something we put out there. That there wasn't necessarily anything other than that was a starting point for the concept of what defining temporary might look like.
Thank you, Senator Mohammed.
Thank you, Mr. Chair. Mr. Bergeron, on page 9, 9.5, it looks like we're redefining the definition of fraud. Has that been heard in committee?
Mr. Bergeron.
I'm sorry, Mr. Chair. Senator, could you point me to the line again?
9.5, starting in 9.5.
Yes, on page 9.
On page 9.
Yes, I believe that that language clarifying what is a credible allegation was included in Senator Abeler's bill from last Wednesday.
Mr. Chair?
Senator Mohammed.
Was that heard in committee?
Mr. Bergeron.
Mr. Chair, Senator, yeah, a week ago Wednesday.
Senator Mohammed.
In this committee?
Mr. Bergeron.
I don't remember, so I'm just asking.
Yep. Senator Abeler presented a bill in committee a week ago last Wednesday that had a number of these changes. I believe that language was included in that.
Senator Mohammed.
Okay, I don't remember that. I appreciate that.
Senator Rasmussen. Any other questions from members? Senator Utke.
Thank you, Mr. Chair, and I don't know where this came from, so who would be the one to get the answer, but going to page 39, line 6, when it talks about the surety bonds, how was that number determined? Anybody know?
Mr. Bergeron.
Mr. Chair, Senator, that was the proposal that Senator Abeler and Representative Hicks introduced. I was not involved in that.
Senator Utke.
Yeah, thank you, Mr. Chair. And that was the thing, when we're missing members around here that played a part in this, I was expecting that I might not get the answer. So we can wait till they get back or something.
We'll do that, Senator Utke. Thank you. With that, we'll take a brief recess.
Senator Abeler withdraws his A10 as amendment. That leaves us to the
underlying bill.
Underlying bill.
Mr. Chair, I have a suggestion.
Yes, Mr. Abeler, Senator?
I think that Senator Rasmussen has an oral amendment, and there's some other amendments we can adopt. And then through the wonders of modern AI, which is the Liam AI, then we'll move the amendments and they'll be placed appropriately, and then we'll be done.
So make sure, Senator, I appreciate that. Make sure we have, when we move this bill to finance, that we have the language in there that is appropriate to give our Mr. Liam the ability to what? Place the language and it's in gross form or something like that? You got that language?
Yeah, I think he might even tell me what I want to say, Mr.
I love it. All right,
Mr.
members,
Chair?
Senator Abeler, we're going to Senator Mohammed now.
Oh, Mr. Chair, can we have somebody walk through the bill first?
Walk through the bill we already passed out of this committee. This is a, jeez. Senator Rasmussen, you have an amendment.
Thank you, Mr. Chair. Yes, on Senate File 4222, the first engrossment,
Yes.
I would move to delete section 15 and section 19.
Okay. Just, is there one more, Jordan? 19's on page 15.
There'd be, and I'm just clarifying the article, Mr. Chair, so just give me a minute.
No, you're good. You got a minute.
Thank you, Mr. Chair. So I would move that we remove Article 1, Section 15, and Article 1, Section 19, and Article 1, Section 20 from the bill.
Members, there was an oral amendment to remove Article 1, Section 15, Article 1, Section 19, and Article 1, Section 20 to the underlying first engrossment of Senate File 4222. Does everybody understand what just happened? I'm going to send... Get on the microphone when you ask that last thing. All those in favor say aye. Aye. All those opposed, same sign. Thank you. Senator Rasmussen, you got another one or you're done?
Thank you, Mr. Chair. I would also like to offer the, let me just make sure I have the A11.
Members, Senator Rasmussen, you want to hand out the A11 or was that already online? We're going to get it handed out. Oh, that's written to his, never mind. Senator Rasmussen, you want to withdraw?
I'll withdraw the A11.
Thank you.
And Mr. Chair, you would just, look to guidance in terms of how we're going to look at adopting additional amendments, because I think most of the amendments were drafted to the DE.
Senator Abeler.
Thanks, Mr. Chair. Senator Rasmussen, we're going to adopt them all with the following advice to Mr. Monahan, that he will find a way to fit them into the draft in an appropriate way. Otherwise, we'll have to take a recess while he figures that out, and that seems like an agreeable way. So, and then when you see the new engrossment, they'll all be very carefully placed in a thoughtful manner.
Thank you.
All
and
the other amendments that are standalones are very appropriate for today.
And as long as we give instructions, senators, Mr. Monahan can explain that.
Mr. Chair, members, well, first, for the record, this is a very unusual situation. Secondly, I am comfortable taking instruction to find the proper place to engross amendments if what is being added are essentially standalone sections, new proposals. I am not willing to use my discretion to integrate a page and line amendment into language to which it was not drafted.
Makes sense to everybody what he just said? So, Mr. Monahan, can you repeat that now that everybody's like going, what is he willing to do? And yes, Mr. Monahan.
Mr. Chair, members, I'm willing to take instruction to find the proper location to engross an amendment that contains only new language preferably in a new section. I'm not willing to use any discretion to redraft a page and line amendment to a bill to which the amendment was not originally drafted.
Crystal clear. So we will give him the instruction at the end as well, just to make it very clear. You guys okay with that? All right. With that, who's got amendments? Senator Zainab Mohammed.
Mr. Chair, it's an oral amendment, and I want to remove page 9, starting line 9.3, that paragraph. Liam? It redefines.
Page 9, members, Senate File 4222, first engrossment, beginning at line 9.3, correct?
That's correct.
And what are you doing with that? 9.3 to 9, no, 9.3 to what line? You're deleting 9 point,
Yeah, I want to keep it as the existing standard of what the definition is and remove this new language.
so removing 9.3, 9.4, 9.5, 9.6, 9.7, 9.8, 9.9, 9.10, 9.11, and 9.12, you're removing those?
That's correct, Mr. Chair.
Oops. Mr. Monahan.
Just a new definition, to be clear. Yeah.
Mr. Chair, members, Senator Mohammed keeps referring to a new definition. Is she referring to paragraph C or to clause 2 higher up on the page?
Senator Zainab, can you answer that?
Paragraph C, where we're defining it, and then also the clause that go with it.
Mr. Chair.
Senator Abeler.
I think the issue is in DISHA and compared to preponderance. And so I think just for the sake of today, if Mr. Monahan can give us advice about how go back to the original definition using the word in DISHA. And just instead of taking it out, I think you need this, don't we? Because isn't it recodified, Mr. Monahan?
Maybe Liam can tell us if it's recodifying or if it's a new definition.
Does what she's trying to do make sense? What do you think?
Mr. Chair, members, deleting paragraph C makes sense.
Okay.
Because that is new language.
Bingo.
Hang on, I'm not done. Changing clause 3, I need time to compare it to existing law because clause 2, it was originally a recodification of existing language that somewhere along the way was modified slightly. So if you're going to start to amend this section, I need time to make sure that you make a conforming change to clause 2 that will have the result of maintaining current law.
Senator Mohammed.
I think my goal was to just go back to existing language, so I understand what you're saying. Existing law.
Existing law, yes, I can do that, but I need
That's fine.
5 minutes to do it.
Nope, take your time.
One, Mr. Chair.
Mr. Chair.
Senator
I think
Abeler.
the current law is stricken elsewhere as part of a kind of a recodification. And so the difference that I inserted here, which is my language, if you go back to pretty much use the word indicia of something or other instead of preponderance.
Then you're good.
Yeah, so I think that it's for the sake of time and just I have to actually go to work pretty soon, so.
Senator Fatah, then Senator Rasmussen.
Just to be clear, is section C 9.3 to 9.13 to 9.16, is that creating A new definition, is that what you're saying? If so, what's the old definition? What's the difference, I guess?
She's saying go back to the old definition is what, that is new
No.
definition there, yeah. That is new definition you're looking at. They're saying strike that to go back to the old definition.
And Mr. Chair, I noticed this because it was also a part of the A10 amendment.
Yeah. Senator
It's the parts I
Rasmussen.
talked to you about.
Thank you, Mr. Chair. I think what we're both kind of struggling with is that within Article 1, there is some language that has kind of been in the A4, has been in the A10, that we have some concerns with.
Yep.
And so one idea that I could propose would be just taking out Article 1 and having Article 2 in. And again, if this is designed to continue conversations, that could be it's my understanding that Article 2 provisions aren't controversial as far as I know. But so that's just food for thought for us to consider versus having to go through section by section.
Mr. Chair.
Senator Abeler.
For Senator Mohammed's concern on line 9.5, if the language is on line 4.27 to 4.32 in that area, on line 4.29, all we have to do is take out we have to insert indicium of reliability. And so to reinstate that language, that was what was originally in the bill that came from the department. And I thought that was just too low of a standard. As a federal standard, we need to really define indicium. And so,
Maybe we should
Senator
ask the
Mohammed, if you look at
agency.
4.29, you'll see that phrase and the same paragraph that you probably want to preserve.
Mr. Chair, maybe we should ask DHS.
Hold on. We're recessed. We are in recess.
Zainab, if you look at 4.27.
Or yours was a motion. So Senator Rasmussen, motion, give us your motion. We will vote on your motion.
Thank you, Mr. Chair.
I'd like to roll call it, Mr. Chair.
Thank you. We will, roll call has been asked for. It shall be. Senator Rasmussen.
I would move to remove Article 1 of the bill.
Senator Rasmussen moves to remove Article 1. There's been a roll call requested. A roll call will disperse when you're ready.
Chair Hoffman?
No.
Vice Chair Fateh?
No.
Lead Rasmussen?
Yes.
Senator Abeler? Senator Gruenhagen?
Yes.
Senator McQuaid? Senator Mohammed? Senator Utke?
Yes.
Senator Wickland? Senator Mohammed?
All members that voted, we have 4 no and 3 yeses. The amendment does not get added on. To that, we have another amendment. Senator Utke.
Thank you, Mr. Chair. I have the A12.
The A12 amendment, members, do you have it in front of you? It's got to get passed out. Senator Utke, do you want to tell us about the A12?
Yeah, thank you, Mr. Chair. This follows along the theme of program integrity. Those that are on the Health Committee heard this last week also. This just takes and it affects the Department of Children, Youth and Families and the Department of Human Services. And you'll notice that we reference chapter or statute 16B 981 subdivision 2 numerous times. So it addresses the financial information required in a determination of ability to perform.
Got it.
And so that's what it's all about. It goes into whether they're a nonprofit and asking for 990s or a for-profit that audited statements, et cetera. But it's just to further ensure whether it's a renewal of a license, licensure, grants, that we're dealing with reputable people and organizations.
Nice work on this. Any questions for the good senator? Seeing none, all those in favor of the 812 amendment say aye. Aye. Opposed, same sign. Senator Utke. No, you only had one. Senator Gruenhagen.
Oh, I have the 813.
813 members.
Should I describe it?
Yeah, go ahead, Senator.
Yeah, prior to 2018, the Department of Human Services Internal Office of Inspector General published an annual report on their licensing background study and fraud prevention measures. The last of these reports was submitted to the legislature covering the 2017 calendar year. Since then, we have seen rampant fraud, far worse than any other state. Again, DHS was doing this on a voluntary basis. They weren't required to, but they were reporting to the legislature so we could have oversight as far as the fraud's concerned. Once this stopped in 2018, fraud exploded. The bill will legislatively mandate that what has already been done prior to 2018, it restores transparency that the public has been begging for. Within this report, the legislature and the public will have transparency into the OIG's caseload, fraud prevention efforts, and ways in which everyone can partner together to stop rampant fraud. Without transparency, we cannot put a stop to fraud. This is another tool, and I believe an important tool, in our toolbox to put an end to a fraud and protect the taxpayers' money. With that, I would urge adoption.
Any questions for the good senator from Glencoe on the 813? Seeing none, all those in favor of the 813 say aye. Aye. Opposed, same sign. It passes. 813. Any more amendments? Seeing none, I'm going to have the Senate file 4222.
I had an amendment.
I gave you the opportunity when I said, so now tell me your amendment, please.
Sorry, it's been so many amendments. Add the EVV amendment. I need to figure out which amendment number it is. I'm sorry.
It's the A17. Go tell us about your A17 amendment, please. Senator
Chair.
Zainab with the A17.
Thanks, Mr. Chair. We heard it in committee a few weeks ago. It was also heard in Human Service or Health and Human Services. It's the EVV language.
Any questions for Senator? We have already heard this bill, the EVV language. Senator Gruenhagen.
So it's a verification? Okay.
It's a good amendment. All those in favor of the A17 say aye. Aye. Opposed, same sign. Thank you. The A17 is now part of the integrity. Senator, we're good? Senate file, okay. Senate file 4222 as amended should be recommended to pass incentive finance with the specific instructions that Senate research or Senate, whatever, Liam Monahan thank you. We're going to do this one without recommendation. So let me rephrase that. I move Senate file 4222 as amended should be sent to Finance Committee without recommendation. And Mr. Monahan, specific instructions to be able to engross the stuff as it does.
Mr. Chair, I think there are many questions from the committee, and my question is, I think Liam was working on an amendment for me. I'm not sure everybody is on the same page on the direction on the bill. I know I'm a new member, but I just want to get some direction here. because there was an amendment being drafted for me.
So the motion right now is to pass this bill and sent without recommendation to Finance Committee, which means when you send something without recommendation, you know there's things that are going to be worked on along the way. This is getting us the ability to work on the stuff that we need to work on, which you could clearly tell because everybody had an opinion in this committee about what something should be done on, right? So guess what? Y'all need to get together and do a y'all come, like they say in North Carolina, and get together. So with that, I want to make my motion to either pass this bill without recommendation or not pass it. I'm not taking any more amendments. The board is closed.
Mr. Chair.
My motion, I said my motion. All those in favor say aye.
Mr. Chair.
Aye. Opposed, same sign.
Mr. Chair.
Does pass. Thank you very much, everybody. We are adjourned.